Welcome to Touch Revolution, the podcast where the value of thoughtful, helpful, and ethical touch is fully realized. Brought to you by Kino Institute of Healing, a rigorous massage school and clinic. Join us on this journey as we delve into the world of touch therapy, exploring its powerful effects on the mind, body, and soul. So, get ready to embark on a captivating exploration of touch therapy. It's time to revolutionize the way we heal, one soothing touch at a time.
My name is John James, and I'm glad to be here. I want to extend a welcome to Ami Opal that is here from Portland and has been here teaching with us and treating patients here for a few days. We've gotten to know her. She was also here a couple of weeks ago during another class, so really gotten to spend some time with you. And then also I have a co-host over here, Megan Pritchard, and so I'm going to do a really soft kind of introduction to you guys, and then you're going to do your own introduction. We're going to start with Megan. So first of all, Megan, one of the things I want to say is that Megan is a master level therapist here at Kino Institute of Healing. What that means is that she is at the highest level you can be at here. What's notable about that is she's 36 years old and officially, by a long shot, the youngest master level therapist that's ever been here. We've been here 20 years. So, don't know if you've ever thought about that, but
no, I didn't
thank
know
you.
that
It's been a pleasure working with you. I'm going to let you expand on who you are and how many tens of thousands of licenses you have. Megan?
There's no more than 5, definitely. No more than 5 licenses for sure. So I didn't start in body work like you did. I started in the healthcare field as a registered nurse and then moved more into holistic health. And when I had my children, realized that there's a whole different world out there that we could be in that was a little more in alignment with me. So I moved actually into midwifery, which I had my children with midwife, so it's near and dear to my heart. And then I've been catching babies locally here in Texas and Oklahoma since 2015. So
Great.
however many years that is, 8-ish, math.
How many babies do you think?
Hundreds. I need to sit down.
500 plus?
No, probably like 300-ish.
Okay.
I don't know.
I need to quit telling people 500.
Yeah, 300 is probably
So-
more accurate.
Yeah.
But I'm still currently a practicing midwife. I have a small home birth practice, so I can really sink into my people. And that's how I wound up coming here, was referring clients. Once I realized like how dynamic bodywork could actually be in helping birthing families. So,
Right.
and then somehow I've managed to get here. So it's brilliant. I also do intrapelvic alignment here. I see moms and babies. I kind of see everybody that's female-bodied for sure.
Right.
But yeah, so thank you. Thanks for the invite and for having
And so,
me.
well, the invite happened because we wanted to podcast with you as well.
Yeah.
But also, this beautiful person sitting across from you is your teacher.
She is. I
And
wouldn't be here
so-
without her.
One of the things we like to do here is to like make sense of like how did Megan Pritchard happen, and like the midwife that you trained with a lot. We've drawn that line before. I know her and she's amazing. And so here we are drawing another line to a teacher, which is really important as an institute here. It's important that when we become something that we begin to draw lines to figure out how we happened. One of the things is, if anything, to be able to give you, Ami, some reverence for helping us locate this human that you've helped with. So thank you so much. So that brings us to you. I know, I mainly know a lot about just hanging out with you and learning with you, and know that you go all in.
I do.
And if I could measure my reverence for healthcare practitioners, it could almost be solely built on whether or not they'll go in or not, all in or not. And that unwillingness to really go deep pretty much answers my question about who we've got. And that is no problem with you. So we appreciate that so much. And I'm going to let you explain a little bit about who you are technically and otherwise, and then we'll go from there.
Thank you.
Welcome.
Thank you. Texas is good. Kino is so good. Well, I am a licensed naturopathic doctor in Oregon and was doing a lot of primary care, not for too long. And I realized I wanted to be touching people deeper in a way that had some space. so they could heal and experience themselves. So learning internal work was, of course, the thing I needed to do, and craniosacral and structural integration and Reiki. So lots of different modalities, but this one has become my favorite. And then I've kind of created my own world around it, my own work around it. So I do want to highlight some of my teachers too.
Okay.
Like that bridge to Ida Rolf. She's such an amazing deep river of old wisdom that we all can build upon for the structural piece. And then Tammy Kent was my teacher for internal pelvic work. She's a physical therapist. And Atienne Piersman is my cranio teacher. So I found this modality could really help me be with people deeply and help them be with themselves deeply.
Right.
And it was like this missing piece when people couldn't touch feelings, or they couldn't touch something that's stuck that they're just really excited to touch or grab or work with. And by working internally, we literally help them go internal.
Right.
So I can't stop. It's just getting richer and richer and easier and easier. And it was so fun to teach Megan because she's already doing all this anyway. And I'm like, try this and try this. Yeah. And it was like the world of midwifery and pelvic floor physical therapy and structural integration kind of came together and wove together. Yeah. That's what I saw. And Megan's taking it her own directions too, in ways.
Yeah, she does that well.
Yeah. Well, I've had a good teacher too. So, yeah.
So how long have you been practicing? Some people are going to have questions about you that are more objective, and so let's answer a few of those, and then we'll kind of run from there.
Let's run from there. Yeah.
So first of all, in Oregon, the naturopathic school is an aspect or part of the medical school, isn't that correct? Or at least a licensure.
But the licensure, yeah. We work as primary care docs, and we have prescription rights and lots of rights.
Right.
We're primary care. Yeah. Cool. It's a fun program. There are fewer schools now than there used to be, and unfortunately, it's hard.
What
to
other
get that
states
education.
are doing it that way? I know Montana.
Yeah.
And Wyoming maybe, but Montana.
Arizona, Washington, California. Cool.
Yeah.
Yeah.
That's good.
Yeah. So I graduated in 2001. So quite a long time ago.
Yeah.
I'm older than I look. And started practicing pretty solidly in 2003. And then it's been about 10 years that my practice has been completely focused on body work. So I had to evolve and say no to some things so I could really hone this.
Right.
And mostly what I wanted to say no to and did say no to was like blood work and talking about fatigue or talking about eating gluten or not, autoimmune disease, that kind of stuff. I just decided there's so many practitioners, they're so good at that. I am just going to work with my hands and see where I can take this work that I love.
Yeah.
What can I bring in?
That's amazing. I think all of us that's been practicing for a while, that we're in this constant state of refinement. And we work a bunch, and then we're at this kind of point where we go, okay, I'm not going to be able to keep doing this anymore if I want to go in this direction. Yeah. Because there's not enough time.
There's not.
Well, just to be correct, there's the same amount of time. There's not a change in the amount of time, but like we begin to need to allocate our resources to something that is pulling us or calling us, which brings up the point. How do you guys feel about the pulling, the calling that you get?
Very important.
It's important, right?
The hands listen, the hands know.
Yeah.
I need to go here. Oh, I need to go here. I need to go here.
Yeah.
I'm not directing.
Right. And your teachers are big on that. Even Ida Rolf was very objective. She's a pretty objective person. But she knew how to follow. Yeah. Did you actually train with her directly?
No, I didn't. There are two people in between.
Yeah. Well, that's cool.
Yeah.
But Etienne,
directly. Yeah. Lots of contact with him. Yeah.
That's cool.
Yeah, he's such a gem.
Yeah. So tell us, you were here. Tell us about the class you're teaching here so that everyone can kind of open up that subject.
Okay, great. And so I just taught a 4-day, very experiential training on making contact with the pelvic floor internally.
Okay.
And how to do that safely, how to do that in a way that people can integrate that, and touching in other parts of the body too to help people integrate. So the concept of diaphragms and teaching confident touch on the diaphragm. So
Mm-hmm.
when and how to work with feet when you need to, or sphenoid when you need to, for example, and also the heart dome and the back of, like respiratory diaphragm.
Right.
So really teaching just in 4 days, and it was amazing how quickly everyone comes right in. It's like we've done this forever.
Right.
Right? And then the internal touch even becomes like not a big deal anymore.
Right.
It starts off as a big deal though.
Sure.
Day one, everyone's like, what? I can't do that.
Right.
No.
But by the end, we're so at peace with the knowing that every part of our body deserves touch and love and to be met by our own selves. So it's just beautiful 4 days. That's just the first, I call it the level 1, which I don't really love levels.
Right.
But the idea is that we start with a lot of physical touch and different, ideas of how to touch and pressures. And then in this next level, we talk about energy more. Like what is a normal pattern in an American woman's body, and why, and how can we influence another pattern that might be more true to her own nature?
Right.
Yeah.
And what would you say? What's the American woman's body?
Oh.
What is that? I'd like to hear about that.
Yeah, really common pattern is doing it all, like having children and working. So we're really busy, and that right side of our body is just on go mode, and so it's a little hypertonic. Sometimes it's kind of hot and internally, right? And the left is just sort of depleted.
Yeah, more empty.
Usually empty, yeah. Pulses are down, presence is down.
And are you relating that to the overuse of the right side of the body, the male side of the body? Or
The under experience of allowing nurturing in. It's a decrease in receptivity.
Right. And then generosity is just being generated, whether she has it or not.
Yeah.
Got it.
Yeah, without that fuel.
Got it. It's like a bank account that's empty.
Yeah.
We see that a lot here too.
Yeah.
Yeah. I mean, that's kind of what we're after here in the bodywork style that we have. Is we have a lot of overlap in your style.
Mm-hmm.
Is that one of the things we're dealing with is just chronic depletion. That people are if vibration is 0 to 100, they're sitting at like 25. Yeah. Trying to figure out what's going on with them and with that. But what's really going on is that they're too close to 0, which is dead.
Oh, and I've noticed the closer to 0, it's almost like some kind of a covering comes over tissues and nothing's coming in. Like the protection gets stronger, and then like let's say we're talking about the left side of a pelvis, that doorway needs to be opened to give energy. I
think what's happening is that area is being blocked because it's about to be given away.
Good point.
It's blocking it like an infection would be blocked. And the body's going, okay, obviously this part of the body is no longer going to be alive. And so I'm going to block it off so it doesn't kill the whole system.
And then what we see is this operation kind of from the top down.
Yes.
From the mind down through the right leg.
Yeah.
And overuse of the masculine.
Right.
And a lot of really hungry people.
Yeah. And so body work wise, and this question's for both of you, is like, when you've got somebody, let's just play the 0 to 100 game. Like 100's like ideal, like hard to get to, but fantastic. Like maybe energetic genius level. And 0's dead. What are we doing here? How are we changing that? How are we dealing? Our viewpoint is that it's unethical to diagnose someone that's too close to 0. Because the body can't generate a real opportunity for a diagnosis. I don't mean diagnosis from us, but a lot of what we're seeing in the medical field is that they're diagnosing people that are almost dead. Does that make sense?
Yeah.
Yeah. So, anyways, I don't want to pass up the question here.
That's
the question is like, what do you guys do about that? How does body work change that?
Personally, I think I see a charge that changes when diaphragms are open. I'm being a little mechanical here, like foot diaphragm open, fascia of the foot open, bones articulating in the way that feet articulate, / now pelvic floor is articulating and moving in the way that pelvic floors move. And something about our body charge then is more like the earth body charge. We're back in.
Ah, I like that.
We're back in. We're back in.
Yeah, I like that.
And we might have disease patterns in organs, but at least opening that so we can be back in.
So for those that are listening, I'm gonna say it this way and see if we're on the same line. Is a diaphragm a horizontal fascial structure?
Yeah.
Okay, so let's give some examples so that the listeners can go,
Yeah.
oh yeah, man, they're everywhere.
Ah,
Pelvic floor, right?
yeah.
Respiratory
Respiratory,
diaphragm.
Yeah.
Where else?
How about top of lungs?
Top of lungs, right?
Little arcs right there.
Yeah,
Floor of mouth.
right.
Roof of mouth.
Brainstem, like at the top of that
What was that?
the brainstem.
The
Like that
brainstem.
area?
Yeah.
And then you could say any joint, any articulating joint.
You could say knees.
is horizontal, right?
You could say ankles.
So so I love that you brought that up, or you keep bringing up the diaphragms,
Love 'em.
because I wonder how many there are. Anybody counted?
In class,
Countless,
we
yeah.
started listing them, and
Yeah.
there's all these pictures of different people saying there's 7, there's 5.
Yeah.
I just think there's infinite.
I think there's
I agree.
like
Yeah.
812. We can label them on like, I'm just random number. I want to answer the question too.
Okay.
So, like, absolutely. But also, I think a huge opportunity with the body work is just the connection.
Okay.
Like, to have them walk through the door, they've made the decision that they are seeking something. And just that commitment to come in, to ask questions about their own body, to make a connection with another human being. That, I think, is huge. And I think for a lot of American women, I think that's a switch that flips. Like, to be in that presence, that, wait, I need something, and I'm going to seek it out.
Mm.
And already, I think, like a third of the work's done right there.
That's amazing.
That they got it. Like, oh, God,
That's
look at you.
Receptivity.
Yes.
That's
They've
receptivity.
opened it already. And then our job's a whole lot easier.
Sure. We just
So,
stay present, right?
Yeah. Stay present and walk them home. Yeah.
Mm.
It is truly, it's about connection. It's about human to human connection. And again, like they made the decision, like whether their great Auntie Bertha told them to come because she'd been here, or like anywhere, like that, they made the decision and they opened the door to their own awareness, their own bodies, and their own healing, especially with the pelvic work that you're doing, that I'm doing. Like, it has to be their decision. They have to be in it. They have to be ready for it, because this is not pelvic floor PT. Like, you're going to dive in, or this is not a perfect fit.
Yeah, you're going to
And-
feel. You're going to feel.
You need to be prepared to feel. And it's just such a deep opportunity. Yeah. When women take that access back and they take that power, just that divinity of, oh, wait, I have a body and it's important. And if it feels good and if it feels better and if I can connect to that part of myself, hey, wait, those kids that I'm so worried about, it helps them too. So we exclusively treat moms first here.
Oh, good.
Yeah. Like, we don't walk in and, like, if there's a baby with a breastfeeding issue, the mom gets treated first every time. Like,
That's pretty big.
yeah.
That
'cause
makes sense.
if mama ain't happy. So, yeah.
So it's
Did
like
you know that about
decision.
us?
I didn't know that. I love it.
So it's not just that we treat mom first. We treat her as if she's the only one that needs to be treated. And sometimes we're right.
Yeah.
Mm.
Yeah.
It's true.
Or if she were to go, you can only treat me or the child, we would go, that's not a problem at all. We'll just treat you.
Yeah.
Wow.
And we use this kind of drafting. We like produce an energy from mom collaboratively that drafts the child of any age. And drafts meaning, think of like, I always think of race cars. There's drafting there. Like the second car is like using the momentum of the first car. But that's not often integrated for mom. Mom's not moving enough energetically. She's not alive enough, so to speak, to actually draft anything, except for negative narratives and bad relationships and all the things that get drafted that do get incorporated from being a low vibration person. So as we begin to prioritize her and she makes that time for herself, like Megan's talking about, we have the fun thing is that people are like, well, you haven't even touched her yet. I'm like, yes, we have. We actually have. We have began the process of interacting with and touching the energetic field that surrounds her. And in that contact, that is a form of contact. The whole game has already started. It's already working.
100%.
Just even for her to go, okay, I'll do it. I'm like, great.
Now we're ready.
Just in that moment, it's already happening.
And in some cases, making the appointment.
just sometimes even the touch that is making an appointment.
Mm-hmm.
So
And this is why when we work with women internally, their children feel it even when they're 15, 20 years old.
it's incredible.
And when I say feel it, they don't feel it.
No. But
Oh, something's happening to my mom right now.
in
It's
her
not
vagina. No, it's not it.
It's a sense of freedom and that energy flow.
Yeah.
It's returned to the whole field forward.
It's a rebalancing.
And you could say also back.
Right.
Goes both directions. And it's presence. It's easy.
Yeah.
And it's not easy.
It's effective
Mm-hmm.
and it's difficult.
Mm-hmm.
It's theoretically simple and very complex to apply. All of those things, right?
Yeah. When you have listening hands, though, when you're doing the work, it's like about training people. The way I train people is you have to kind of move through the bumpy stuff first. Like, what are you worried about? What's scary to you or overwhelming about a pelvic floor or a pelvis? And then when they get through that, it's like easy. You're just touching tissue, and the tissue is doing the same thing as all the other tissues. That's saying, "Please touch me here. I don't have enough blood flow here. Come on, start listening."
Have you noticed that? Well, I'll go back to our own practice over the years. Before I started working on bellies, I noticed that people were holding a lot of stress in their belly, and so I started working on bellies, and then I'm like leaving out other areas because you just do. And then I was leaving out cranial work. This is 30 years ago. And I started incorporating cranial work and realized that those energies, that non-productive pattern was being hidden in that area. And then followed that to under the tongue in particular, especially lymphatically and energetically. That people were then holding it there, and then we're back in this loop at that point where we went from abdominal to cranial base, and those horizontal fascial structures, and then we're back. Once we go under the tongue, we're back in the pelvic floor again. And one of the things I noticed is that if you stay on these tracks, that you start to find that it's not go that way and then turn around and come back. It's like it's in a loop. Because if you were to work in that loop, you would eventually make it back. You make it to the feet. Right? You and honestly, I don't know that you would ever be able to end an appointment. Like you should end an appointment, because you would get this sense that a patient has had everything they needed that day.
Yeah.
But these treatment styles that we're employing here, and I think you're very much the same way, they're like endless cycles. They're round.
They are round.
They're not linear. And although you can study them in a book, they're not there. They're in your own work and in your own practice and in your practicing, not in your reading.
And they integrate for people individually in such a beautiful way. The work integrates, like you do the frenulum jaw work or sphenoid work, and you're back at the pelvis, back and forth. And then they go away for 2 or 3 weeks or 1 week, and they're integrating that into their lives, and they're coming back, and you do another, and you do another.
Yeah.
Get deeper, find the different things that they need in that space, because as you'll see, as things open up for them, as things are released and then things open up, like that, it brings whole new facets or new memories or new things that actually need to be healed.
Yeah,
it's
new
something.
Levels.
Yeah. People ask all the time. They're like, "How do I know when I'm done?" I'm like, "Well, I don't know that where any of us are ever done.
Right.
This is not. It's not a journey with a destination here. It's a path."
Can we talk about though that one kind of expression that seems to take situations into another level? Like, for example, pelvically.
Yeah.
Say you're working and you're on a spot that's been really dormant for a long time. All of a sudden blood flow comes back, fascial flow comes back. They're connected leg to pelvis to heart. Oh, they're voicing something new now.
Yeah.
And it's moving and they're saying it. And then you'll feel this wave of energy. Boof, and it comes down and oh, look at that. It's like a birth.
Yeah.
And maybe it's dramatic and maybe it's not dramatic. It doesn't have to be dramatic, but literally you feel something they're done with leave, an energy or an expression.
Oh, absolutely.
And it can be a finality to something.
Oh,
so
to certain
the
things.
loop can have these big, have you noticed that? The loops have these big
Well, I mean, when we
expressions
start connecting loops, a series of connected loops doesn't tolerate certain things. And so people go, I need a particular chronic behavior to go away. I'm like, well, if we clear these loops, we're working these fascial loops, energetic loops, lymphatic loops, meridians, and all the ways that those things are not separate. Make sure you're clear on that. We're working in those loops. At some point, it starts to kick things out. And the things that it could convert to being useful, it will not kick out. But there's a lot of things, old patterns, old stories, people they're angry with. I don't know. We can go on and on, right? Sometimes, I mean, from our perspective, sometimes darkness, dark entities started things. People pick up things, you know. And we can, when we start reconnecting these loops, we start to remove the potential for them to even for that negative pattern to even live there anymore. Can't live there anymore. We see where we really see that is at the end of the appointment, because we talk a lot. We talk to patients a lot, and I'm talking to them, and I realize that their original complaints, they kind of can't remember them. Like it produced an amnesia. So, and I realized that so much of remembering has to do with a thought in my brain that then goes to find its home and in the body. And when that person goes back to connect those two, it's not there.
That's lovely.
And, you know, that's what's been beautiful here, as Megan brought to us. Well, Megan brought us Megan, which was really nice. But she also brought us pelvic floor work, which here in Texas, massage therapists are not, it's not legal for us to interact with someone that way, and that's fine. But it's been really nice to have her here, because believe me, like, people were hiding things under their tongue last, and now it's in the pelvic floor because we can't go there. And now we can. And so in this facility, we're like, we see you hiding there.
So those big loops as a collective for Kino really shifted.
Oh my God, that was huge.
Yeah.
That's so cool.
Yeah. And so it also has made the work deeper here. Like, it's just, once again, it's another level of personal work being done. So
I like what you said about things that need to go, and things that might need to integrate and could be helpful. You didn't say integrate. I think you said things that can be helpful don't go.
Absolutely.
I love that.
Yeah.
That's a fun part
You
of
see
being
it
a
that way?
practitioner. I do.
Yeah.
I do. I almost see this like energy of like I'm working, work is happening, and some things are leaving and some things are staying, and it, like, you can almost watch it go into the heart, and they're with it.
Yeah.
They're in it. Their heart's like churning it.
Yeah.
And I'm like, oh, good, you're keeping that. Okay,
Yeah. Yeah.
We find a lot of people here, and they come in and they think that the way they are is not okay.
Yeah.
And I'll get OCD and hypervigilance. I'll give that as an adaptive trait that people think they shouldn't do. And we joke that sometimes we just need to hire people that are OCD. Like, you know, an OCD person would fix so many of the problems we have, you know, as a business. And so a lot of times we see that someone is here and that they have developed this narrative in their brain that the way they are is not okay. And what we see is that we're working more on deactivating, teaching them to deactivate so that they can go back to that trait that's so easy for them when they need it. And we really find the problem is not the trait. The problem is they never turn it off. And so much, once again, with the pelvic floor, where it's one of the places where people hold hypervigilance.
Yeah.
Absolutely.
That's the reason birthing gets challenging. I mean, I know both of you can speak to that.
Yeah. But you turn off that vigilance and you allow that,
Yeah, it's incredible.
like, tailbone to let go and the back of the pelvic bowl to just be soft. And then the support is there. And so the hypervigilance can unwind in all the areas. I mean, I'm oversimplifying, but that's one of the first things we do. I think the first day of making internal contact is we help each other in the back part of the pelvic floor, the piriformis and coccygeus muscles, to be exact. We help those release and be more full.
Yeah.
And people, then they don't have the same story, just like that.
In your classes, how much of the work are your students actually working on themselves internally?
Not much.
Not much.
We would go right into partnered work.
Okay.
Yeah.
Got it.
There's homework. She gets homework.
Okay.
Yeah.
But
Yeah. And there's self-care after.
Yeah.
But it's safe enough. The container is, the pelvic container is, I just want to almost say, like, it's designed for partnered work.
Yeah.
Yeah, of course.
Of course. Hands only bend certain
Yeah,
directions.
it's perfect.
That's true.
It's really perfect. And partnered work is also perfect because your mind is not connected to the same thing that's the vigilance. So the vigilance is resting while someone else makes contact.
Right.
Right.
And the person is obviously very grounded when they make contact.
Yeah.
So by vigilance. It's beautiful.
I know some people that are listening or watching might have they're trying to figure out how does this work? You know, that's a very subjective question, but can you answer that? Like, can you walk us through like a session?
Oh yeah, thank you.
Because there are a lot of people that don't know. They don't know yet.
Yeah. Okay. So I need the story. I need the story first. Not too much of it, right? I'm asking people, what are you here for? Yeah, what are you here for? What's going on for you? You want to hear the loops. You want to hear the tangles. You'll hear that all in the story.
Right.
It's real. And then I'll say, how are you feeling in your body right now? And so I get them into the feeling the body place a little more. How's your pelvis? How's your back? And maybe that'll come through in already the first share of like, I'm here because my doctor said I have something, and I don't know.
And are you
what
hands
to
on
do.
at that point, or you're just
This is mostly just chatting in like first 10 or 15 minutes. And then we move to hands on. And for me, the style I like to work in is sometimes they're on the table with all their clothes on, and I'm checking on things, and I'm doing a little cranial and a little structural assessment. And part of that assessment is to see if they can ground energy. See if their channels are open. Like if sometimes there's so much stuckness. Right. You can't safely work. Yeah. It's going to be too much of this and throw them into a spin. Right. And so first I'm checking to see, okay, can energy move? And then usually 15, 20 minutes later, we're at a place where we can start working internally. And so then I ask them again, when you tune into yourself, do you feel like you want to work internally today? And I'll use the words like, check in with your vaginal opening, your labia, your womb space. How's that feel? And then I really come out of the shared field at that point. So I'm not influencing it because I know I love working, and I just sit here grounded and I let them just feel into it. And then I get yes or a no. I don't always get a yes. It's great. Yeah. Some people are like, I scheduled this and I don't want to today.
Yeah.
Right.
Yeah.
Okay, great.
But like that's already like
else.
That's that decision.
So what are we healing right there?
Yeah, exactly.
There's like quite a lot of medical trauma that we're already healing in that conversation. That's
just profound opportunity.
Yeah.
Just right there.
Yeah. So if it's a yes, they're on the table and they keep their shirt on and their bra on, and then they have pants and underwear off and they're draped. And I'm left-handed, and the left hand is such a great hand to work with because it's less logical, more connected. It's closer to the heart.
It's receptivity.
Yeah. So they're on their back, and I've got my chair on the left side of them, and they've got two legs bent and feet on the table. Right. I put my glove on and my lubricant on, and I say, okay, first you're going to feel my touch on your right thigh. So that way they've just got clear ideas of what's going on. And also if I've noticed they're sort of afraid or their body has a little edge to it, I say, do you want me to walk you through the whole session first? And I love when I get to do that because you can just feel the mind is like, oh, okay, this is good. I got this. And also people like vaginally 20 minutes of work is great. Yeah. It's really all that needs to happen in one session. Right. Unless you're doing one of those long ones where you take it all the way through. Right. But most people, I'm doing hour and a halves, like it's not hour and 15, hour and a half. So we're just doing a little bit here, a little bit there, a little bit, and then they go integrate. So going back to the session, they're on their back. I touch the inside of the right leg, and then I make contact with the labia, and I let them know, you're going to feel my touch on your labia. Okay, I'm going to insert my finger. Sometimes I just wait right there because there's so much work at the perineum. Right. For birth trauma, for obstetrical trauma, for gynecological trauma, for sexual trauma, all kinds of things.
Everything.
And it's so vulnerable for people to come to that place in their body and just be present there with someone else touching. Yeah. But with the right, and so I'm teaching a lot of the presence of how to do that, just being grounded and you're not in someone's space so far, you're just next to them.
Yeah, just present with them and whatever's sitting there with them.
Yeah. Yeah. And then after about 30 seconds, then I usually find that the introitus is like, okay, you can come in now. So I insert my finger and I go right to the easiest place I can go. Usually it's to the back left. Also, it's because I'm left-handed, and so there's already an arc there. I think there's already just something.
It's not just, at that point, you're connected.
Yeah.
So it's not just what's easiest for them. It's ease in general.
It's what's in the field, the two people.
I love that. That's so important.
Easy. Yeah.
That's so important.
Yeah.
That's a really good point. Yeah.
And I recognize that we bring what we are to the work naturally.
That's good.
Yeah. So then we're following fascial lines and patterns and listening. And sometimes people start working right away. Like blood flow will come in right away and pulses will happen, arterial pulses, energetic pulses.
Sure.
Things will start happening really quickly. Sometimes it doesn't happen right away. And what you can do is just ask them, do you feel my finger here? Do you feel it here? And start getting an idea of what they can feel or don't feel.
Are you shocked sometimes that you're in the back left and you say, where am I? And you're like, they either don't know or they say in the right front. Like, are they often off?
They're usually off. Yeah. And I'm not shocked.
No.
So that alone
Shocked
is a really good thing to correct, right?
Yeah.
For them to be able to feel where you are.
Yeah.
Right.
That's like the first thing. I mean, that and the back walls.
Yeah.
But when they know what their right side is and what their left side is, think of how they can be more centered in their lives. It is a direct translation.
Yeah.
You're not going in
amazing.
circles anymore, you can say.
Right. Yeah, you know where you are.
Yeah.
Mm.
And in knowing, they can also say this is not okay with me.
Yes.
Where I am.
Yes.
I don't mean during the intravaginal work, but it can recover that kind of awareness.
Yes.
Mm-hmm.
Yes. All of a sudden they have agency again.
Right.
Love it.
So agency and receptivity.
Yeah.
Huge.
big
And
deal.
it happens in 5 minutes. Like it starts shifting so quickly.
Yeah.
That's why I love teaching this technique. And
We'll end it.
that's why I love it. It happens quickly. You just have to be patient as a practitioner. You make contact and you wait. And then they return to themselves.
Mm-hmm.
Right.
Yeah. It's an unfolding. Like, but you can watch it and kind of
Mhm.
trickle in, or then with some of them, it just rushes in, you know, for some of them, it's just tears. Like to even just know what their own female anatomy, what the terms are. You're like, oh, what? And that's that flappy bit, you know? Like, oh, that's your labia minora. You know, just that awareness, especially in our culture, so much of that's lost. So just to have someone be present with you to say, oh, no, I mean, this is beautiful.
And the reclamation when they return to that and there's a word for it or something mental, it's like the mental body connects to the physical body and the heart's in the middle and you feel that unification. It's great. You're like, oh, good, the work's done. Although it's not.
Right.
Now the next question is, does the pelvic floor move freely? Usually not. Usually one side is hypertonic and one's hypotonic. Like usually not. It's easy for these things to be out of balance. So then comes a really fun work of releasing tissues that are tight.
Right.
Piriformis a lot.
Yeah.
And helping them bring fullness back to tissues that are empty.
Yeah.
That's really fun.
That's perfect.
Yeah. So it's really easy.
That's funny. One of the things I want to bring up is how Megan has used intravaginal work. Let's say some of it's from what she's learned from you, and some of it's probably already there, just to be clear. But but I was in a birth with her, and so I got to see her work intravaginally during the birth, baby positioning, just all of the things. Can you speak to that at all? I don't want us to miss that.
Sure. No, it's a really good opportunity in birth for sure because it's extremely applicable. I mean, it's certainly, you can do so many things with these techniques. And again, just like even just presence.
Right.
Just the awareness of, wait, your baby is right here. You know, because I mean, we think cervical exams, vaginal exams, and this is so different. This is just really intentional, like presence-based touch.
Right.
Like, okay, and like, let's breathe into this tissues right here. This is right where your body needs to stretch. This is where your body needs to open. That sensation's your baby on your sacrum right now.
Yeah.
You know, or you have a little bit of a cervical lip. It's swelling a little bit, but that's okay. You know, let's bring your attention here. Let's surrender in these areas and let me work with you through these different channels of your body to see if these tissues want to empty.
Yeah.
You know, and usually they do. I mean, the body wants to be in alignment. It strives for it. And if you move the things out of the way, it's graceful most of the time. You get big old babies out of pelvises. Moms do all the work.
Well, you also bring her back. Like disassociation is so prevalent.
It's huge.
And when you, rather than me going, I need you to come back into your body. I heard that so much as therapist. I'm like, you're talking to the wrong part of the brain.
Agreed.
You know? But when you start working, even if you're not intravaginal and you begin getting them to connect to areas of their body that they are not connected to, then they start to come back because they're being touched in a really meaningful way, you know? And they're not directing it either. A lot of therapists I'm noticing, they wait for their patient to direct them. And that is a kind of work, but so much of the type of therapy I've watched Megan do and the work that we do here at the master level is directed by the therapist, with full permission and trust and all of the things. But
The listening therapist.
the listening therapist,
The following.
Yeah.
and knowing that the symptom that is being reported is actually the body saying, "Hey, look somewhere else. This is not it."
Mm-hmm. Totally.
Yeah.
And I don't know if that's 100% of the time, but I think so. I think pretty close.
Yeah.
Yeah.
It's fun how it just follows right along though once you start.
Yeah.
You mentioned emptying.
Mm-hmm.
That's a big part of the work, is being a neutral presence for someone to empty.
Yes.
That's so big because the receptivity sometimes doesn't seem to want to give way until something's emptied.
Right. There needs to be space.
Reminds me of what you said in the beginning about, I think they're kind of capsuling it off.
Yeah.
So that capsule isn't opening until something goes. And I was wondering if you'd speak about, like, in birth, when something's emptying, what are you often finding in moms before they're birthing? Is it fear? Is it
It's
what's
it's so
emptying?
much. It's so many things.
Yeah.
So, and of course, there's fear. There's fear of the unknown and the life changes. But there's also past traumas that they're birthing through if they haven't had the opportunity or the help or the guidance to clear these things out. I mean, just even, they're birthing through change, but they're also birthing through this really dynamic cocktail of life events. It's different for every single person, but there's so much overlap. There's so much overlap, whether it goes all the way back through childhood or, it's whether it's teenage experiences or their first sexual encounter. If there's something unresolved from that, or if there's shame from that, or if there's fear from that or pain, then what an opportunity to connect with these women and then watch them literally birth with ease and grace and so many times because everything's out of the way. It's just, it's clear. It's a channel. It's a portal of new life. And if you're not bumping rocks along the way, then it's even easier. So
I feel like when I see people like 3 and 4 times, 5 times, the first 2, they are usually clearing so much shame, cultural shame or family shame.
Yeah.
And
Generationally,
it's so much about being caught masturbating as a child, or, oh, your menses are dirty, hide that blood, or no sex until whatever, or never, or only like this. Like, there's so much expression that's pushed down publicly, and there's so much of a division right here. That's also why I love to work right around that diaphragm right here, so people can breathe,
and the liver
down.
with all the repressed anger
about the cultural shame around this subject.
Yes, of course.
So if it's a childbirth, great. If it's a personal birth, great.
Yes.
The shame needs to move. And I think they make the first appointment and okay, there's the beginning of the unpacking of the shame.
Absolutely.
It's just so fun to sit there just neutrally while people realize it's their body. They have a right to occupy that space.
Absolutely. They have the right to feel their own space, that it belongs to them. They get to keep it. Like, hey, this is yours with all of its working parts.
One of the things that we have seen is that sometimes shame has been coming up for me today a lot. We got to talk about shame today. So before I go there, I'm curious, how are we defining shame? Does anybody have a definition for it? I don't. I mean, I can make up something, I bet. But what do you guys think? Can you define it?
May I define it in a way it feels to my finger?
Yeah.
When I touch it in a body?
That would be amazing.
Okay.
Yeah.
It's like a folding in, the tissues fold in on themselves, and there's a sensation of usually temperature decrease, although the anger would be a hot temperature behind it. So it's cooler and it's got a density, and if it had a color, it's dark. It's like a wad of dark.
Yeah.
It certainly doesn't have blood flow, good blood flow.
Right.
Certainly doesn't have great chi flow, and it's definitely not bright. And after a lot of work, people feel bright, right?
Yeah, absolutely.
They feel bright inside, and when we touch them, we're like, ooh, that's bright.
Yeah.
Yeah.
And not shameful.
Yeah,
For me,
so it's dense.
It feels like a pulling back.
Mm.
Like I feel like the tissues are almost like whoa, like let me. Does that make sense? Like it's it's not that full connect. It's not the meeting. It's it's almost like a stepping back is what it feels like energetically to me. So
And that could be also just like straight up trauma that could pull it back.
Absolutely.
So if we're just talking shame, it's like it pulls back and it has a little cloudiness to it. It's just very unnatural.
Yeah.
So something in this definition, I think shame is mostly unnatural.
Right.
Like it's really a human thing.
For me, some weird thoughts about it, but one is the word occupied. Like someone when shame is there, someone else is taken over.
Well said.
So you could say that shame is not true self. So now true self could be there, but it's being covered up by someone else's driving the boat or whatever. The other thing is the word, the letters or the words sh is in shame. And so for me, be quiet is a part of shame.
Absolutely.
And the other thing is that the word should could be incorporated into it, like should aim. And so those are the kind of thoughts I have about it, like that there's all these different pieces to it. I like to kind of pull it apart a little bit because it doesn't like to be pulled apart. It doesn't. Like part of one of the primary ingredient of the success of shame is being secretive. Like not being called out. So I like to kind of in our conversation, I just want to kind of pull it apart a little bit so that we can make sure that it knows that we know it's there.
Great.
Does that make sense?
Total sense. I keep hearing should aim for. What should we aim for? What should we aim for? Like,
yeah, absolutely.
Just be.
Yeah.
Yeah.
Be present. There.
Now I'm trying to remember where I was going with that. That's really great direction. I'll figure it out.
Yeah, we'll find it.
Yeah. I do not remember. Let's take a break.
Yeah, let's have a break.
For that. All right, we're back. What a great break. Everybody better?
So much
Yeah.
better.
That was great.
Yeah.
That was really great.
Yeah. Bathrooms are really clean here. It was really lovely.
Thank you. We have more tea. What is this? Tell us about our tea.
Yeah, we're drinking a red tea right now. Red teas are useful in bringing your mind into the center a little bit more. It's great for creative projects or getting things done. So it's not too strong though. It's still quite feminine, but it gives us a little more clarity.
Yeah.
Connection to the heart.
Kind of concise.
It's kind of concise in a really sweet way. Yeah.
So what are we going to talk about?
Receptivity and shame.
Okay. All right. So something specific?
I'm hearing you talk about the shame that you were experiencing, and I could talk about the shame I've experienced and felt a little, nervousness coming into this morning. And then you helped me get receptive to it and not push it.
Right.
So there's this thing that happens when we get receptive to whatever's going on for us.
Right.
And we're talking about shame right now.
Yeah,
so,
absolutely. And one of the things I've been using for the female side of the body, the left side, the word receptivity is the common word. And for the male side, the right side, it's generosity. Have you heard that?
No, not till today, and I love it.
I like that. That's
and
good.
so, and maybe another word would be generating.
Generative.
So and the other word would be receiving. So I'm receiving, making, and generating. The making word would be in the middle.
Like the
Does
womb
that make
space.
sense? Yeah.
Prostate.
Yeah, absolutely. So receiving, making, generating, receiving, making, and so. But shame, one of the things we're talking about is shame sometimes is a really, really good way to get what we need. Like if we're feeling shameful, there's something there. And I think one of the things that's different about us, especially at our master level here, is that when someone's feeling shameful, it gives us a lot of information. So like if we can get them in touch with that experience, then we can see where they're holding shame. Because shame, if there's shame just in the mind, all of us have some sort of mental construct for shame. But if it has nowhere to seat itself in the body, then it's not shame. Like shame is not a vocabulary word. It is a mental story of what it means, whatever that is. combined with a very specific physically held restriction. And that union together, that's shame.
That's shame, yeah.
And that's what's cool about body work is body work breaks that bond. And it's kind of like amnesia in a way where you go, well, how do you feel about shame now? And you're like, I don't know, I feel fine. But you still know it's there. So it's not full amnesia. But when you go to get it, it's not there because the physical restriction's gone.
Totally.
That's what's cool about trauma. Trauma is also a great teacher.
It's like you're unlinking.
You know, it's popular now. It's popular now to look, no, let's get rid of your trauma. I'm like, well, before you get rid of it, why don't we use the shit out of it?
Can we talk to it
let's
first?
Let's make it your bitch, you know? It's true. It's true. Like,
Come on in.
Like, really, why don't we take this thing that is, and that is that you want to turn shame upside down? There it is.
There it is.
Take
That's so
shame
good.
and go, I am so glad you're here. You now work for me. And you're going to teach me everything I need to know to be free. And that's the way to release shame. And you do if you try to do that without body work, it's going to be a long haul.
Please don't try to do that.
No, it's going to be,
work.
that's kind of like trying to do it without affection.
Oh.
Because really, I mean, it's not popular to say that body work is affection. It is.
I know.
It's very specific, thoughtful, and ethical affection. And the better your therapist is at applying affection specifically, the better it's going to work really well.
Agreed. It's okay for there to be some love.
Absolutely.
There should be some love.
Yeah.
It's not very popular to say it though.
It's not. It's not. Hey, I want to talk about something. I bet you love this subject coming from Oregon. What about religion? What about religious shame?
Wow. Yeah, it kind of breaks my heart.
What do you
I
hear
see it a
about
lot.
Texas?
I heard that I heard in Texas it's like the Bible Belt, and that it's really restrictive, and people aren't going to be open to me here.
Right.
And that's because I want for everyone to have expansion through the areas of contraction, and that's not a popular thing when there's a certain set of rules, and the rules are we sit this way, we act this way. And I just see it a lot. It happens that I see it religiously. It's not all that. It's whatever is causing the restriction. There's so many things. Choose one. I happen to hear Texas had a Bible Belt kind of an energy, and it was going to be hard.
Right. What's your experience been so far?
It's been amazing and loving, and I pressed up against some edges, and I felt my own constriction.
Yeah.
And then I just settled in, and I taught, and everyone received it. Because it's truth. Because it has no language really of words in the English vocabulary. It's a deeper.
Well, it's also not
knowing.
For or against anything.
It's just truth. Actually,
Yeah.
it's truth.
Yeah.
It's fullness and truth in the body, heart, mind, spirit. So. But I was nervous, and just even talking about it right now, I feel a little. I don't want to offend anyone, but we all have a right to our bodies fully.
Right.
There's some rules that we choose to play by or don't. And being a human is interesting in those rules. Yeah.
Yeah. All right. How do we do on that subject? We good?
That's pretty good.
Good. We need to go deeper.
I think there's more.
Yeah. Megan, you got anything?
I think y'all are doing great.
I mean, why is it in our pelvises so much? Why is it in?
Well, I mean, of course it is.
Place we sit, you know. I
mean, it's generationally deep. I mean, our mothers are birthing in it, or even just the act of conception, like especially in the Bible Belt area. I mean, you can look at all of it, and then again we get back into shame. You know, so it's huge. It's
pleasure and shame. Why?
Absolutely, yeah.
Why?
Like it's a direct crossover, and so many of it.
Pleasure's really expansive.
Yeah, kind of a big deal.
Do we perhaps not trust ourselves with pleasure? Do we not trust ourselves to be fully present in our bodies and not hurt others? Is that a common situation here with humans? I don't feel that, but
I don't think it's a common situation here with humans. I think, just to back up, I think Texas being, if it is the Bible Belt, which I can see that there's evidence for that. And on the other side of that, there's some really good alternative care surfacing here. It's really grounded, like deeply grounded, proud and grounded. That combination makes for a state that's really good at healthcare. And I saw that coming a long time. And there's other states that I saw that were very open, but they seem really ungrounded to me. And here, what I've noticed, and a lot of those people from those states keep moving here. So I've interacted with them a lot, and they're like, "Dude, healthcare here is really amazing." And I mean, from the body work perspective.
Wow.
And so that's kind of my take on. And it's not just a theory. Like I keep testing it and feeling and interacting with people about it specifically. So I think, first of all, I think the Bible Belt, if that's what we're going to call it, combined with people starting to wake up, and some of those people still honoring their beliefs, because we have an entire movement of very religious not woke, but crunchy folks here, very religious, and it's although they're Bible Beltish, it's also some really good. People are doing some really good work there.
They love it. It's their choice. It's their faith.
But I do trust that if it wasn't this, it would be something else. That's the part of us that's kind of a pitfall of being human.
I agree. The belt idea.
Yeah, but it's like a pitfall, and so by a pitfall, meaning that wherever you went, they're doing something very similar. Whatever country you go in, you can go to another country that hates all of us, wants to kill all of us, and they're doing some sort of similar thing.
Self-restriction, shame type thing.
All sorts of things. They're relying on what they know to carry their day.
Yeah.
And I would say that's a pitfall. There's 7 pitfalls of being human. I don't remember all of them. One of them is to rely on what you know to get you through your day.
Oh, wow.
And the idea there is that we begin to expand outside of what we know. The aha moment. You think of what we know in the sliver of all of the things that are known. It's like a smidget of what's really knowable.
Yeah.
Even in Christianity or even in other religions, we really don't. There's so much we don't know. You know what I mean?
I do. When you speak it, I feel it.
Yeah.
It's great.
So with that being said, I think one of the things we can trust is that shame is here to serve us and point us in the way of healing. And if we didn't have it, we wouldn't know how to heal. And so, so for as body workers here, that's what we're here to do. And one of the things that's required of us is to open up all of the areas of the human body and have someone that has access to that. So that includes the pelvic floor, right?
Sure does.
And all the other areas.
Sure does.
You know, I'm sure the body will find somewhere else to hide it.
Little corners here and there.
Little corners here and there, yeah. It's continuous.
Sometimes I feel it up in the liver and stomach. You know, there's like,
right.
You can do mouth work so easily here.
Yeah.
And you can do vaginal or rectal work so easily here.
Right.
What about that? Look at that. You can hide all kinds of things in there.
That's true. Well, that's one of those areas that we more produce an energy that's so robust that it'll push it out for us. Think of a garden hose that we're just turning on the water to unwind it.
Yeah.
You know?
Yeah.
Does that make sense?
Yeah.
Yeah. And so, so we're using a higher energy flow. We call it resuscitation here.
Oh.
Like we're bringing someone back to life. Imagine that when someone's being resuscitated, that you're pushing on their chest. And things start working again, right? It's very similar to that.
Are there certain positions you put your hands on the rib cage?
Yeah.
Or,
Well, the positions have to do with one oriented around the posterior aspect of the body, or what people call posterior, the back. The other one opposing that, or vice versa. Doesn't matter. They have to. The experience has to be that they're connected. You can't give anatomy for that, because then you'll always be off. You go, okay, I need you to contact the medial aspect of the spleen and the posterior aspect of the liver, and you'll always be off. Because the fact is that's not the way it works.
Yeah.
Because of its infinite woven nature, it doesn't work that way.
Love that.
You got to follow it. Now,
Gotta
hey,
listen.
now here's the other subject. It's going to be really fun. You guys are going to love this. We've got shame, and we've got religious shame, and all the other things. And then on the other side of that, we have pleasure.
Yeah.
One of the things we notice is that people are starting to experience pleasure, and that gives them something, right? It's got a therapeutic value to it, but there's also some shame there.
Yeah.
Can you talk,
Yeah.
maybe both of you talk about like what's happening when you're training people, or you're working with patients and they're coming back and they're like, I've never had an orgasm like that before, because they go home and that's what happens for them, but they don't want to talk about it because they're not supposed to talk about being pleasured.
Or
What do you
want
think?
it.
What do you think?
Yeah, there's something I see probably in over half of the women I work with.
Yeah.
And they have pretty great experiences afterwards, usually after a couple of sessions. And then it's like something is shifting in their identity, because I can feel them kind of wrestling with it a little bit, like, oh, is this me now? Can I do that?
Right.
Woo-hoo. And all the other beliefs will trickle in, or something from childhood, and then they're expanding with that, through that, integrating that. But sometimes there's like a shame hangover. I think I talked about that after the class that you and I were just in together.
Yeah.
People did a lot of expanding, and there's this kind of this sense a couple of days later where the energy gets dense, and it's an opportunity to go, ooh, what is that again? That's that shadow of that thing that just moved.
Right.
And pleasure is such a driving force to that.
Right.
There's also anything kind of natural, like dancing.
Right.
We could talk about all those natural things: orgasm, pleasure, dancing, natural movements. Those all produce so much charge that it makes the other very illuminates the shame. It illuminates that, and so then I think we expand through it, and then it kind of comes back, and we get to see it again.
Yeah.
That's what I notice.
That's cool.
Yeah.
You got anything, Megan?
I mean, again, like just coming back like to self-awareness for the women that we see, for them to realize like, oh, like to go over, how many different zones for pleasure do you think you have? And let's discuss it. And let me explain this to you, and it's not uncommon for me to like fully discuss it. Like, this is how you activate an A spot. Let me I'm going to show you externally, this is, and just explain their body to them in a non-judgmental, non-sexual way.
Yeah, I've seen you. I heard you do it. You're very good at it. Yeah.
And it's, I mean, it's a,
they just sort of start purring.
yeah, they're like, hey,
Thank
talk
you,
to me,
Megan.
but because I mean, it's not like sex ed through high school was effective. Like, none of us know. I mean, some of us know, but most do not know. And so, yeah. And then just to almost like decriminalize it by talking about it. So, and it's probably not the perfect word, but it's kind of perfect because
you notice people are kind of on the outside, and then you start talking about it, and they come into this like knowing like, oh, I belong here too.
Absolutely.
Megan's there and I belong here too.
Yes. Like, oh, we can talk about that here.
I get to have this too.
Yes. Like, this can be mine too.
Yeah.
Like, I can, yes. And it's, I mean, again, it's just, it's such a simple thing, but it's such an opportunity. So, yeah.
It's like with pelvic work, we're kind of at the doorway. We're at the precipice. We're like, here's the door. I'm just going to show you the door to yourself.
And this is your door.
Yeah.
That you can access. Enjoy. Yeah. Have a great day.
This is your door. Have a great day.
I'm pretty sure that's your door.
We'll talk about your doorbell later.
Sometimes I invite people to get back to me about their doorbell. If you want to share about how it goes, let me know.
Exactly. Yeah.
But usually they don't. They just they are so grateful.
Oh, I have people share all the time. They come back and they're like, "Let me tell you."
Yeah.
So, yeah, absolutely.
I feel like sometimes the language is limiting. Like, we don't have enough language around this subject for people to share without getting caught in little shame puddles or whatever. And so they come in and they don't exactly say it, but I know what their body is saying to me, which is, that was good. I want to go deeper.
Right.
Yeah.
Show me more doors.
Shame puddles.
Shame puddles.
Shame puddles.
Have you said that before?
Yeah. Yeah. It's like
Here's
in the
the
English
thing.
language.
Here's the thing. The way is through talking about it.
Yeah.
Is
About
the reason
the
we
puddle.
can't find the words is because we don't talk about it.
Totally.
That
Because
makes perfect
we don't
sense.
actually have the words because we don't actually talk about it. And so, this is a good avenue for us to, we're just in a conversation here. That's it. Like, so if anybody's watching this and it bothers them or anything like that, we're just talking. We're just trying to talk about something that nobody's talking about.
Yeah.
Things that deserve to be talked about.
Think about that when you're raising children, like how much help it is for them to just be able to talk. My father had his doctorate in health, physical education, corporate health. There was a movement for people to go into corporations back in the mid 70s. And I was living in rural Georgia. He was at Georgia College in Milledgeville. And they hired him as his doctorate in health. And so his dissertation had to do with corporate health. But somehow he ended up teaching sex education. And back then, it was really popular to be really super open with your kids. Like, it was kind of post-60s kind of thing. Civil rights movement. I lived in Georgia. Civil rights movement. It just happened. Some people would say it finished. I'm like, no. It was really a mess when we got there. But anyways, there was a lot of very open conversations. Like, that was very popular in my family to, like, talk openly. And I don't know. It's funny how I still found shame.
Yeah, you did, huh?
I did. I still found it. Like, I still did it. Like, I still found shame. And I don't know why that is. I don't know why. I don't know that I need to know why. But it comes up for me is like, why does that happen? Like, why would I still go there? So I think it's because this shame is actually really valuable.
Yeah, what
I really
a teacher. Yeah.
Is that it's just valuable, you know?
Yeah.
So
It really points us, doesn't it?
yeah, it's good. It's like a beacon.
What are the missing words? Like in the English language, we have missing words about
We
this.
do. Can we exhaust it? English? You could.
I can always
Megan
exhaust
can
the English
exhaust the
language.
English language.
Yeah. Oh, yeah.
so-
I love words on me.
Oh.
So many words.
I had her.
Too many words.
I had her work on the 15 conditions of life when she first started here.
Yeah.
And she said, "Do you want to read these?" I'm like, "Yeah." She handed me 17 pages.
Handwritten.
I've had a lot of people do that actually, and I usually just get notes, but I got 17 pages, front and back.
Yeah.
Yeah.
It was a lot of words. I'm
So-
overdue to rewrite it again. So
Oh.
Yeah.
I'm really in this shame conversation in my mind right now. And
Okay.
I'm thinking it has a lot to do with belonging and maybe possibly some kind of evolutionary trait about like when groups survive things, we have to act certain ways to stay together and we stay in those agreements.
Yeah.
So we're all safe.
that makes
and so
sense.
perhaps there's that really old.
Like tribalism.
Yeah.
Yeah.
Yeah. And so that somehow is mixed in with this.
Yeah.
And here we have all of us doing different things with different religions and beliefs,
Right.
but all of us wanting to have expansivity and pleasure and real experiences.
Yeah.
Where we outgrow the old
Well, it's
ones.
funny. I mean, the irony is that we're trying to break away from the tribes that produce the shame, and
Right.
yet we're producing a tribe that is broken. I mean, it's just a new tribe.
Right.
Hmm.
Yeah.
You know,
And they're pointing at the
whether
other
it's
ones
crunchy
and-
folks or
Mhm.
Oregon folks, or whether it's like, you know what I mean?
Mhm.
It's always
Texas
always
folks.
something, right? It's like some sort of categorization.
Mhm. Yeah.
We're just constantly doing that. You know,
Mhm.
what does this have to do with body work?
Yeah. What's
It's a
this
good
have to do
question.
with body work? How do we get on
Yeah,
this?
everybody thinks that
Mm.
this is separate.
Mm.
Everybody thinks that
Mm.
all of this stuff we're talking about is separate from their body. It's not true. Right?
Yeah. We think it's sometimes I think people are so stuck in the stuckness too that there's a story around the stuckness
Yeah.
that this
Yeah.
this expansive conversation unlocks.
Yeah.
So when you go to someone and you very gently work in their mouth,
Yeah.
they're not stuck holding on to it. You're already working it.
Yeah.
You're already saying all the words through it, and then the whole idea is unlocking, and the tissues are unlocking. Same with me
Yeah.
in the pelvis and Megan in the pelvis,
Mhm.
and you in the pelvis, but that's not legal.
Right. True. Do you work in the mouth a lot?
Not so much. I seem to focus more on the pelvis.
Yeah.
Yeah. Yeah. I love it though. I do a lot of cranial work out externally.
Right.
Yeah. And then sometimes I'll touch a little.
And your
internally.
your cranial training,
Yeah.
Etienne mainly,
Yeah.
or did you upledger train at all?
I didn't.
Good.
Skipped it.
Mhm.
When I read his book on children, on babies, it was really helpful. I had done a lot of work with babies at the time, and I was finding myself being called back to in utero positions. Like just over and over again, I would look down. I'm like, that's probably where this baby was in utero. So, in his book, I don't know if you've read it. It's got a lot of baby pictures of him working with babies, and it looked like the same positions that I was in. And of course, there's a lot more. He's a really amazing practitioner, and so it was really helpful in other ways. But it was cool. It was cool to see him. Wow, we ended up in the same place. We must be chasing. We must be ending up in reality or something. You know?
Yeah.
So
That's why we're talking about this.
right. So
There's benefit in that for all ages. I mean, you saw in the training, you saw me put one of the beautiful women back into a fetal position, like, and she took herself there. Like that's where she needed to go to express this deep, like, anger that she had finally gotten access to. And like, I was like, hey, you look like you want to kind of tuck your chin. And then she took her chin and she like took herself into a full curl, and it was on. And if you like allow that space to let people like have that full expression, to really like sink in, like, hey, you know, this is your body, listen to it and see where they want to go. Like it's not an uncommon way that I see people go. Like with my pelvic work, people are moving all over the table. Like it's very uncommon for me to have knees up on the back. Like we're going wherever they're going, and I'm going to follow them. It's like birth. But I follow women in birth and catch babies in whatever position they're in. I'm doing pelvic work in whatever position you're in. And that them being able to listen, like, what do I need to access this? Yeah, it's
And they're accessing that while you're moving around with them.
absolutely. Yeah.
I
It's
work
opening
with
something.
a lot of trauma, pelvic trauma,
Yeah.
and so I give them the grid of working with them on their back
That makes sense.
is so they can continually return,
yeah, to
because
the
they
midline.
they will so often leave.
Yeah, they'll be
Yeah.
out. Which
what do you
makes
mean by
sense.
leave?
Like disassociate.
Yeah, it's a dissociation. Yeah,
I just want to make sure we were talking
Yeah,
about
we're talking about the same thing.
Yeah.
Yeah. Yeah. But I love it when I get the opportunity to move with them.
Yeah, and
Like
I
do
see how you
sideline
can.
work.
Yeah.
And I'm willing to go there when they're ready.
Of course,
But you
they
know how
aren't
we always get what we're good at working with. Like, that's what I'm working with.
And I think
So
that's
interesting.
beautiful because it's such a need.
Mm-hmm.
That opportunity to heal through those traumas, or even just express those traumas.
That is healing.
That is
See,
healing.
that is it.
That already.
Can the tissues open and close?
Mm-hmm.
Is the cranial rhythm present? You know,
Right.
Does the Kegel work? Can they squeeze? Do they have access to the whole musculature and to the energy of the womb, to their creative energy?
Yeah.
That's healing. Just accessing, because then it just goes on its own.
Mm-hmm. Yeah. It all just flows.
Good word to demystify is healing here. And shame points us in the right direction, right?
Every time. Every
What do you
time.
need to heal? Where's the shame pointing you?
Man, I love shame.
That's
Shame
gonna be
is so cool.
That's a new spot on my intake form. What are you ashamed of?
Yeah,
What really scares you? Okay.
Let's start there.
have you noticed that once people are open, that they feel more joy?
Absolutely. It's right behind whatever that little thing is that wants to move.
Physiologically, do you know what that is? Do you think you know?
I think I know.
Yeah, I'm curious what you think.
I'm curious what you think too.
Yeah, well, cool. Well, you go first, and I'll share.
It feels physiologically like an uprising kind of an energy that makes a smile on my face and sort of like tickles my heart. And then I laugh.
Yeah.
There's a laughter in it, like things move.
Yeah.
Joy.
Effervescence.
You're good at carrying that
Joy.
kind of energy, though, right?
Yeah. I go there pretty easily.
Yeah.
I like come back into it. Like I'll leave.
Yeah.
If I'm busy and serious and gotta get things done.
Right.
And then I just like get back into this like cycle that feels like joy.
Yeah.
Like I'm supposed to be there. I belong there. We belong there.
What about autonomic function?
I don't know. What about autonomic function?
Do you feel like that's tied in at all, or do you know?
Yeah.
We've noticed that that a lot of people come in tunnel vision. And so think of the autonomic function being constrained. Let's say vagus nerve innervates the diaphragm. It's constrained, and it begins to produce a systemic shutdown. whatever, polyvagal theory, call it freeze, whatever. But along with that becomes a loss of peripheral vision, because tunnel vision is the loss of peripheral vision. This is just my own thinking, so we'll see. And as we work through pelvis externally, and we work through visceral manipulations that would produce freedom, and we create diaphragmatic movement and move breathing out of the head space, and kind of that whole pattern, following it out of cranial work and oral work and all that stuff. And one of the things that happens is vision opens, and with that comes joy. And it makes me think of when I was a single father. He's almost 25 now. We had been going to church, and we had been having good churchy experiences together. We got baptized together. But I always had a hard time telling him, like, what is God, though? Like, what is that? And one day there was a sunset on the side of the road, and we pulled over on the side of the road, and we got out, and we stood in the back of the truck. And I said that there it is. And it made me think of the horizon effect, of how one of the things that there was so much joy in that moment and that day is because my vision was required to move lateral. And that one of the things that's happening is one of the reasons people are showing up here sad and leaving here happy is because they are getting lateral vision. Things are opening up. They're getting the horizon effect. They're beginning to see the entirety of their future, maybe. Does that make sense?
Totally.
And so I think that's where joy is coming from physiologically. I think it's something like that. And I think I wouldn't just say vision, or I'm talking about vision from all of our different chakras, how they can, how that they can be tunneled as well. You know, the pelvic floor doesn't just close off like a door. It comes in like this. It constrains cylindrically, if you will. And so as that opens, it's a spiraling opening, right?
Right. First and second chakra.
Yeah, absolutely.
Both cylindrically closed, if closed.
Right.
Yeah.
And so we could experience joy in those areas as well. And then there we are back with our old friend, shame.
There we are.
Yeah, there it is again. You know, everywhere we go, it's there as we try to expand. It has to be there.
Yeah.
We wouldn't even be able to expand. We wouldn't even be able to expand if it weren't for shame.
Correct.
Think about contraction expansion cycles. Like,
right.
We're unknowingly dependent on the contraction.
We don't like it much.
We don't like it, but we should get after it. You know.
Yeah, we should get after it
because you know.
And celebrate that in each other a little more. Hey,
right. Hey, I see you're having a horrible day. Congratulations.
That must be really helpful.
Get it.
I was telling Megan, I have a friend that says that there's only one statement that's always true that you can say at any time, and that is what you get. And so we can test that today. You know, somebody says like, "Hey, my dog died," and I'm like, "This is what you get."
That is what you get. That's the statement. That is what you get. Wow. Wow. That is what you get.
It's dark humor.
I like it. It's so real. It's funny. You say that and I find joy so fast. Because they're horizontal things.
Yeah.
That's what you get.
That's what you get.
Human experience is interesting. That is what you get.
Yeah.
Yeah. I think when we, getting back to the autonomic nervous system, just the moment that we allow people to expand, then they can start this other churning process of sort of like, you know, oh, there goes that. I'm going to keep that. But if we're all constricted, especially vagus nerve, we can't. There's not a conversation yet. No. So, thanks for bringing that in. There's like that's that first 20 minutes on the table, right?
Yeah, absolutely.
I'm like, I don't know if we're ready for this whole thing yet. So
yeah,
let's just talk to all the nerves.
One of the things I noticed about advanced practitioners, whatever that means, you know, people that are not afraid to be proficient at body work. There's my definition. They don't touch their patients first. They talk to them, all of them. They don't just send people back. And that's one of the things we teach the young stars here, which are a group of chosen students here at Kino that start very early on with very advanced training. And they're taught to talk first. Because once we interact with some sort of touch, we change things. It's kind of
Yeah.
like a pool of water that's very still, and once we touch it, it changes it dynamically. And it's not wrong, it's just different. And we really have this opportunity to observe and listen. You know, even if we're like, how's your day? Or we can go, how's your mother-in-law? And then we can say, that's what you get. You know, but we can kind of play around with it,
Yeah.
and we can really get a chance to see how people carry something.
Yeah.
Absolutely.
Like when you asked me about religious shame.
Yeah.
Yeah.
Did you experience that a lot?
Exactly.
Yeah.
Yeah. Yeah. Right when I was coming into puberty.
Yeah.
Mhm.
You got the conversation.
Mhm.
Yeah.
Yeah.
The
And I got all the eyes on me
Mm.
that I thought weren't supposed to be on me, you know,
Yeah.
like a bunch of men looking at me at 14, and
Yeah.
I was so confused. So I got the talk, closed.
Right.
The cylinders went honk,
Right.
and I closed to myself.
Mm-hmm.
I closed to my own pleasure, and I closed to my own creativity. I mean,
Yeah.
I'm okay.
You made
Yeah.
it. But,
The shame showed me where, and here I am, and that's a good life, but that's what I love working with now. Obviously, is where did you close to yourself?
Yeah.
Mm.
Can I meet you there?
Yeah. Remind you.
What have you primarily used for your own work?
Mm.
Like you work with body workers,
Oh, for my own, yeah. A lot of acupuncture.
Oh yeah.
Yeah.
Cool.
Yeah, and I think a lot of body work, and then
Like old school acupuncture,
yeah,
like
then
the
old
real
school.
thing. Yeah.
Yeah.
Cool.
Like a lot of needles. Is that what you mean?
Yeah.
Yeah. Yeah. First, a lot of body work, and then that was. I'm not done with body work, but it feels like those meridians really. I want those to be
Right.
touched gently with needles. I really love the interplay with anything up at my crown and anything that's in a sort of a deeper channel. Like
Right.
that dance is so thrilling to me right now.
When they do that work, you can feel everything open. Yeah. Yeah. That's cool.
Mm-hmm. Mm-hmm. And
What
I really
else?
want to bring my blood flow to all the places, you know. So
Right.
yeah. I also, you know, worked with a therapist for 8 years.
Therapist, talk therapist.
Yeah, talk therapist. Just
Yeah,
talking
cool.
it all out. And then she does beautiful clearings, like with a gong and drum, and
Nice.
so she'll reach in and help another frequency come in to help me see where am I hanging on to something,
Right.
where am I tangled, mind and spirit. And then also shamanism and the practitioners who teach me the value of like words and the words I choose and the way those thought forms are hanging out or not hanging out.
Yeah.
So a lot of people, I've been working with people lately on expanding those thought forms.
That's cool. Can you define shamanism?
Not really.
No.
Can you? Somebody help.
I love to make up definitions. So, yeah.
Mm.
I think, first of all, I think a shaman, I didn't go out to be one.
Mm-hmm.
So there was at least a calling of some sort. I've worked with a shaman from Peru a lot, and then I have someone that lives on our property that has practiced. Well, it's certainly not a place without trouble.
Certainly.
Yeah, so there's not that. There's not any. There seems to be no hierarchy there, which I like.
Mm-hmm.
Seems in religious structures, if you were to compare them, which maybe that's not a fair comparison, but if you were, there's a lot of hierarchy there.
Mm-hmm.
And I think shamanism has had a really good place in healing because there's no hierarchy there.
Mm-hmm.
You know, if you're in a ayahuasca ceremony and a shaman's serving you, they serve everyone and then they take a drink themselves. And so there's that.
There's that.
You know, and all the metaphorical ways that affects them. So I don't know.
I'm feeling elements when I think of trying to define shamanism. It's like it's like everyone getting into the flow, the elemental flow, the what seems like actual existence.
Yeah.
Of myself as a human and an animal in the flow of all things. That's shamanism. What are the bridges
like
to that?
Yeah.
So some people work with smoke, or some people work with rocks or fire, or all of the above. Song.
It's all a return,
To
though,
reconnect us into.
Yeah.
in whatever way. Yeah, it's all a return.
that's such a big subject right now that can be scary for people.
Yeah.
Yeah. It seems like there's.
Yeah. If we were to talk about the Bible Belt, you know, absolutely.
But in a class, we're sitting there in class, and what brings relief to everything is Megan's like, I'm gonna go light a fire.
Yeah.
I'm like, let's go walk by the creek.
Mm-hmm.
It's always the basics.
Yeah. That's true.
I think that's why I love acupuncture.
I saw an acupuncturist years ago. I don't think she's practicing anymore. I don't know how old she would be. So one of the things we were talking about on the break that we'll catch up with here is that I had been seeing an acupuncturist that she was amazing. And I had told her not to treat me like an American, which had come to be like multiple times. I'm like, dude, I wish I had, because I would look down and the needle was just like gone. There's nothing but just the head of the needle sticking out. And but I went in one day and I drank back then too. And so something I'm also remembering is I was kind of hungover that day. I think that kind of made her mad, maybe. But anyways, I'm in the lobby and there's a sign that says long needle, $30. And I'm like, oh no. Because I knew the minute she saw me, she was like very excited to see me because she knew that I had already given her this, like, go ahead. And so she's like, I got something for you. So she takes out this 9-inch needle. By the way, I jacked one of them so I can measure it later. And it was 9-inch needle with a braided head on the end of that. So it was over.
Ooh.
So it was in a plastic sleeve, and that because it was so flimsy. And so she palpated above the pubic bone, and she popped the braided head, still plastic sleeve still on, and it went through the skin a little bit. And then she pulled the sleeve off, and she started spinning it. And she's like, "You sure you're not on blood thinners?" She's like, "You sure you're not on blood thinner? Aspirin." Like she's going down a list now. But at this point, this thing is disappearing, and by the time I looked up, there was nothing but the braided head left. And then she started turning it, and I'd feel it like, prostate area, rectum. Like she was all through the pelvic floor with this needle, and of course at some point, like I had an emotional release, and this is 20 years ago. Like I wasn't emotional releasing that much back then. I can get there a lot easier now. But I had this like emotional release, and I really I was already doing a lot of external pelvic work then, but it really opened up like access and something else that she said. I said, like, how in the world did you get trained for this? And she said, you have to treat yourself only for 2 years. 2 years, like start a clock. And then there's a regimen. But it made me think about how valuable it would be if we were like, no, you have to treat yourself only for a certain period of time. And I think to some degree there's part of that going on here at Kino of like,
For
no,
sure.
you got to treat yourself.
Yeah.
We can teach you techniques. We got to treat yourself.
Yeah.
But anyways, that's my long needle.
Right back there, all the way.
Yeah.
Wow.
All right. So what are you not talking about? I feel like you're holding back on us.
Yeah, I think the subject of belonging is kind of begging for some attention
Okay.
in healing communities and in this work. And perhaps pelvises are an interesting place for that conversation because of the nature of us wanting to hide our desires because of common belief systems
Right.
in this country.
Yeah.
So when we have an area where we hide things,
Yeah.
that becomes a fertile ground for the question of belonging. And so what I notice when people open up is they look at me like I've just given them the keys to the universe.
Yeah.
And I haven't. I just stayed in my own belonging to myself. And then, go to the door, show them their door.
Yeah. Hey.
And it's just so demystifies this whole, if there's a made up hierarchy of like, these people get to have it and I don't fit in. So the pelvis and the genitals, I think are exceptionally fast areas to work in for that
Right.
result or for that, and not that I'm like results driven, but it's a wonderful nuance of this work that easily goes into their whole lives.
Right.
Like it's like I learned a lot of great heart connection things growing up and stuff, but when I birthed my children, had large babies and some interesting birth injuries.
Yeah.
Like, oh, how am I ever going to sit again after my first child? How am I ever going to make love again?
Mysteries.
And then it all worked out. But by going into the root chakra and second, this deep belonging, like I belong to my desires belong to me, and I'm not a weirdo. It just kept echoing and continues to echo through my life. And every time I teach a class, it becomes larger for me.
Yeah.
Like I fit even more. And especially this, like, I'm going to Texas, the Bible Belt thing, that whole story. Oh, it works. I fit. This work fits.
Right.
We all belong. And that's also shamanism, right? Shamanic practitioners we're not standing above. We're really not standing outside of. We're standing with everything and inviting people to be with everything, including themselves, with equality, with that horizontal line. So that's what I wanted to say. Is this work is it's not just a pelvic floor. It will touch everything.
Sure.
And you could almost work on the vagus nerve right from the pelvic floor.
Of course.
Of course. So it is nice to have that 20 minutes beforehand, and it is nice to hear the whole story. But if someone said to me, like, you can only do one thing with people, what will it be?
Right. You would just talk
say,
to them then.
Well,
No.
I suppose I'll get there. But first I was thinking I would really like to be able to touch the back left side of the pelvic floor because that's where the lack of receptivity is. And lack of receptivity is lack of belonging and a feeling that you don't matter or deserve. And that's the biggest problem I see right now with pelvises.
And you've suffered that yourself.
Sure. Yes. Actually, it was the birth of my daughter on the left side. It's a little personal here, but I'd like to share that I had a tear on my left side, and the tear doesn't happen because I was so present there. The tear happens because I was so not present there. And why was I not present on my left side?
Right.
Because I was really taught that, like, desire is bad and masturbation is bad and periods are gross, please hide them. All that was what I was taught. There's the long list, of course. So I wasn't present there, tore there. Lots of shame there about tearing, kind of. And there was even a shame of, like, can I ever have intercourse again?
Yeah.
I felt funny about that. I felt sad about that, but I also felt ashamed of that. And I was so happy to get work on that line that was a tear that became like then there was scar tissue, and then there was release, and then there's continuity. And that was the journey here, really. And why, if I could do one thing, talk to people, but also the left back. Yeah.
We see
like a pillow.
We see lower left of belly almost without fail.
Mm-hmm.
When I say almost, like, I can't remember last time that wasn't the primary problem. You know?
Wow.
And maybe, people are like, why is that so? Like, is it because you sit on the right side of the table? I'm like, no, that's not it. Lymphatic system slanted left. That could be heart's slightly left of midline. And then female receptivity.
Yeah.
I don't know what, it's funny once those primary areas are influenced and opened, I don't know if open's the right word, but if they're expanded, people become far more unique.
Yes.
But in the beginning, not that unique.
Yes.
Those areas of closure, they're very predictable turns, from our perspective. Yeah. So.
I feel like on the left side, I also wanted to share that the expansivity over there, maybe you notice this too, if you can introduce to someone that they can live there and they can breathe there and they can expand that their belly or pelvis.
Yeah.
That then they have kind of access to the whole, like, crayon box of uniqueness or of what their expression is.
Right.
But without that, there really isn't. I think they're saying the same thing here.
Yeah.
Yeah.
I absolutely.
It's without the breath in, what are you doing?
Right.
We're driving from here down,
Yeah. I wanted to add that, like, especially like you're saying with the birth of your daughter, like, if you're not tuning back into that place and healing that space, that stays. It can stay. I see women that they haven't had a baby in 20 years, but still, their body is holding that space for that left-sided injury or for that tear or that episiotomy. Like, we're finding 2-decade-old episiotomy scar tissue that's just like, oh, like, please pick me, pick me, pick me.
And sutures.
You know?
And sutures.
And sutures.
Yeah.
Yeah. Yes.
Wild.
And sutures. So, yeah, what an opportunity. But yes, like so much that back left. And me too. It's always my back left too.
Yeah.
So.
Something about being alive right now.
Something.
No. I mean, it's always something, as you said, but here's what I see in the story right now of humanity.
Yeah. So many repeating patterns. And there's even just in that, again, coming back like, oh, look, there's an opportunity for connection. You're not alone. And
I've noticed you really vocalize that to people. I've heard your language with it. And I've noticed myself, I'm a little slower to say it because if I just wait there, it's like they get there.
Yeah.
So either way.
What are you slower to say?
I'm slower to say sort of the therapeutic words of like, that a therapist would say, like, you know you belong, right? Or, you know it's okay to be yourself, right?
Sure.
Or,
I sit in verbal affirmation with people a lot. So it's my love language.
Yeah.
But so I like to use it freely.
Yeah. Yeah. I'm a little more like touch is my love language and let them arrive and see what's in between.
Absolutely.
Yeah. It's fun to see what's in between. Like, I love this question. Like, what's coming up for you right now? What's here?
Yeah. Yes. Where are you feeling that?
Yeah.
Wow.
Can you see how you can just do from one point, you can unwind so much?
So much.
So not you can unwind.
Well,
one unwinds so much from one point.
Absolutely. Yeah.
Probably I could talk to them too. Just talk to them.
It also doesn't hurt to talk to them. I would probably just talk to them if I had to pick one thing, but lower left back's good too. Maybe more useful. I don't know.
How about you?
Oh, I was actually thinking about birthing and rebirthing. Yeah. And how often the releases that we're seeing are really mini births. You know, whether it's emotions or whether it is actual, I'm sure in your weekend you just had here teaching that someone birthed again.
Absolutely.
Yeah. And so in that, there's just varying degrees of rebirthing. Best way to put it. Sometimes a purge of tears or laughter or vomiting is a birth in a way. And what I like about that and body work is that serves as it's a form of paradigm shifting because I'm literally resetting everything when I go through one of those processes. There's a reason emotional release is so important, you know, because it gives when my body goes back to reference where it came from, it's finding something new. You know, and birth. Dr. Upledger wrote a book called Somato Emotional Release. I think page 53. He has a chapter called Incomplete Biological Process, Birth, Death, and Other Transitions. So that's birth, being born, and that's death, being dead. And that's everything in between, you know.
And
so
all the middle ground.
It's like all the, you know, I'm nothing but a series of incomplete biological processes.
Yeah.
And so he says that he's speaking about C-sections, and he was talking about how, you know, what I like about that subject is it's been something that we've worked with a lot here, but it's also an obvious incompletion.
Yeah.
Because some people go, I'm not incomplete. But when you get into C-sections, they're like, hell yeah, I'm incomplete. This is not what I expected of you. And then a lot of times they go into, I'm just so happy that my baby's safe, and so are we, and all of that. But the experience of being incomplete is pretty much across the board the experience. And so he says that when you leave a mother and a baby like that, incomplete, that they go on to experience something he calls retained biological frustration. And we went on to define frustration as the inability to metabolize. So it's what surfaces when we can't metabolize something. And by metabolize, it could be literally metabolic process like lymphatic fluid or whatever, but it could also be an emotion, like a metabolization of an experience. And what I would mean by that is that if I haven't made sense out of what's happening to me, then I haven't metabolized it. Or if I haven't made it useful, like shame. And so the shame theme that seems to be driving this conversation is no longer that frustrating when I've found a way to make it useful. And what's beautiful about touching people is it drives that at such a different speed. Because over time I might figure it out, but if no one's touching me, I'm not going to figure it out anytime soon. Or even fast enough to know what the hell's going on. A lot of times the experience is so spread out that we can't really figure it out. That's the nice thing about body work is it compresses the experience, right?
Yeah.
So
Beautiful integration. I see it so much.
Yeah.
With the completion of birth. Megan sees it so much with pelvic work and the completion of birth.
Yeah.
And also the completion of the ovarian arc where the ovaries want to make a lot of ideas or they have a lot to contribute and those ideas don't always get brought into form.
Right.
You can kind of work with that pelvically too. Like bringing a lot of clarity into the fascia around the ovary so the communication is better between ovary and uterus.
And so I'll play devil's advocate. Like there's people going,
what?
Creativity and ovaries, like what are you talking about? Like creativity's in your mind, right?
Where does it come
and
from?
I agree with you. I
I
love the subject.
Yeah.
It's like, because we watch women who have hysterectomies all the time lose their creativity. We do. Watch it all the time. So you got anything to say about that?
So much to say about it. I think we can find creativity in a lot of different places, but the seeds that generate the creative force that is like the easiest ones to work with in our lives, I think they come from the ovaries. Those ideas that then go to the womb for generative work. They're more, I think, more tied to like, what are we here to do?
Right.
What do we come here for?
Yeah, I like it.
Yeah. And it seems very connected to mother, of course.
Yeah.
Because we were in our mother's bodies and our grandmother's bodies. The little egg in the ovary of our mother was resting in grandmother's body. So there's this like fertility that comes through. And when we claim it and when we work with it and when we, use that creativity, unpack that creativity, open the creativity, keep the ovaries flowing, we're really like fed by all the lineage before us. And you'll see this thing with women where someone's a beekeeper, so was their mother, so was their grandmother. Or it was horses, or it was farming, or it was weaving, those kinds of things. And so there's just this like decadent, fertile energy that cannot be stopped. Right. Not that we can't invent from here or invent if we don't have ovaries or a womb space.
Right.
Obviously you invent all the time. And people can have a hysterectomy and they can still find all the same things. But sometimes there's an aching and there's a distancing, and you have to come back in it purposefully and reclaim it. But it is raw. It's like raw creative flow from those ovaries. Yeah.
Right.
Where were we before that?
No idea.
All right. It's been a good conversation. So, any last words? Any last thoughts? And before you go, though, I'll let you know that this is not our last conversation. So when you go to come up with last thoughts, they're not actually last thoughts, but for today. Do you have any last thoughts before we begin to close?
Yeah, I have thoughts for listeners experiencing any discomfort in their pelvises listening to this. That's a great sign that your body might want to experience this work. Yeah, internal pelvic work. And there's a lot of ways to receive this work. Different kinds of practitioners do it. But being with yourself, touching yourself, bringing a warm compress to your perineum, taking baths with essential oils, and actually making contact with your own skin, your own vaginal wall, and finding your own cervix, this is usually what
Yeah.
the body is aching for is that contact and that reconnection, and that loop will begin to show you where to go next for your help. So
That's good.
Yeah.
That's good advice.
yeah, thanks
Right.
for having me.
Oh, it's great to have you.
Thanks for being here.
Megan, you got anything?
No, just thank you, Ami. Thank you so much.
you.
And thank you, John. Like, this is, what a good conversation. We're so happy to have had you here.
Thank you.
Yeah, absolutely.
Well, for me, I've really enjoyed this and have really an idea of exactly where this would go. I might be kind of new to pelvic work in some ways, but what I'm not new to is following the body until there's nothing to follow. And what I really know about that to be true is that will never happen. We'll never find a day where there's nothing to follow. And so I really, really appreciate both of you and how you embody that idea. I think it's real. I think it's true. And I think it's, for that reason, we'll be around for a long time. I think not only are we in a touch revolution, I think we're returning to reality. Yeah. Because I think at the end, one of the things that we cannot escape is reality at some point. You look at how healthcare's come and gone. Look how medicines have come and gone. Oh, wait a minute, this medicine everybody has to have. No, this medicine is dangerous, and now it's gone. And it went away because it didn't work, and it was not close enough to the way things really work. And so what we believe here at Kino Institute of Healing is that if we can work as close to reality and the way things really work, we'll be successful. And so what that actually means, that means that we have to work with ourselves first, no matter how nasty and ugly it is. And that, and from that, we have to then share that, and that has to be through touch. There can't be exceptions to that. It has to be, we have to be able to touch people. And that in that, and that we also have to expand and grow from there. We have to recruit. And so one of the things we've been working on is calling in people from afar. So 2 weeks ago, we had Wilco Idama here, which was a lovely experience. And then now we have you, and we got more coming. And so what we're wanting to create is this experience of bringing people here, not for any other reason than to connect the value of touch across the land. And so this is one of our newest efforts at that, and I would consider it extremely successful. We'll always be deeply appreciative to you, and I have a feeling we're gonna be seeing you more. I think you liked Texas way more than you expected.
Yes.
So
Yes.
there's a lot of good people here. There's a lot of people here that have a commitment to being free, and we honor the hell out of that. And one of the things we see all sorts of religious beliefs here. We do have a lot of diversity here that's kind of hidden. But one of the things we see that's in common is there's a lot of people who want to be free, and they don't want to live in places they can't be free. So, on that note, from the behalf of Kino Institute of Healing, we want to say thank you so much for being here for our podcast. And if you need us, give us a call. Thank you.
Thank you.
We want to explain something. We just came back. We actually ended the podcast, and we realized we weren't done. And so we have a commitment here to follow. Here, Kino Institute of Healing has that commitment, and we live by that. And so we followed ourselves right back over here to continue. And now we're talking about our old friend shame again. It's funny. Like shame. We started off our conversation with shame as a thing that needed to go away, and now we are fully realizing how important shame is. So that's where we are. That's what we're talking about.
It's sitting right here.
Shame's good.
It's sitting right here, and pleasure.
Yeah, all of it.
And why? Why do we do this work? Why do we love this work?
Yeah.
Well,
How did you even get here?
Yeah.
Like,
why am I still here?
Yeah.
Doing
Why
this
do you
work?
stay like every day? Why is it? Why is it a calling? What makes it a calling? And how important that aspect is of the work.
Well, let's answer that question. Each of you, let's answer it.
Whoa. Yeah.
So for me, I can't not touch. Yeah.
Why?
I can't not touch. Like, anybody that's sat next to me, including on a European flight to go see my brother one time. By the way, I got upgraded to business class for fixing this lady's headache.
Oh,
Cool.
yeah.
Right
so,
there. Like,
so I wasn't looking for that payoff, but the fact is I couldn't help but help. I couldn't help it. Not like, it's just that natural. And it's really nice to do something that feels that natural. Doesn't feel like work, right?
Yeah.
gotta
Right.
flow. Gotta
And
flow.
like when
gotta
I'm
follow.
stuck, I can just go do what's natural and I get unstuck.
Mm-hmm.
Yeah.
Mm-hmm. Me too.
Yeah.
Me too.
So
Yeah.
it's really helpful. Like when I'm stuck, what if I just go do what I know to do?
Yeah.
So how about you guys?
I deeply love this like alignment of someone's like crown and pineal and like mind and midbrain over the heart, over the sacral chakra.
Right.
And it seems like something I can't not do. Like if I'm on a flight, I want to work on everyone. And I'm like, and I don't. I get all constricted.
Yeah.
So I'm trying to find different ways. But what really keeps me in the work and what I get up for every day is knowing that one more person or 10 more people, or usually four a day, not 10, but will have this experience of easy alignment within themselves, which is then there's also belonging, there's creativity, there's pleasure. We're letting shame stay now.
Yeah.
And then there's like how they get to be held in the container of that and then share that with everybody.
Yeah.
So it just feels like it's like the beacon gets all set up for
Right.
like whatever their faith is all about. Here we are back to religion.
Mm-hmm.
They are more cycling their faith. They're more cycling with their own spiritual beliefs and their heart center and whatever they're here for, and they get to express that more fully because alignment. So
Right.
I love to work pelvically for that, and I tend to see people for that. I'm very comfortable there. But that's really what it is. If I weren't working publicly, I'd just be here or wherever. I love it. I got to do it.
That's good. Megan, how about you?
I mean, for me, it's like to see what an opportunity it is. Like, is such a big deal that would be very, very hard to step away from. Like, fully sink in and immerse and see, like, sound cheesy, but I like connection and I want to make a difference.
You're so good
Thank you. But we can make a difference. Again, even just with communication, even just with connection, to take that minute to show somebody like, hey, like, I see you.
Will you share a little about that difference? Like you were talking about women postpartum and that feeling of, am I broken? And then that they move across the traverse and they're just like across the bridge of functioning again. Can you share a case or share what happened yesterday, today already for you? I feel like you do such profound work, as do I.
Absolutely. I mean, there's so many different stories and so many different cases, but what I was talking about, like when I see women that come in, they're like, am I broken? Mm-hmm. Like they're literally coming in and meaning like, is my pelvic floor broken? I either have pain with sex or I'm leaking urine. Like these really, really fundamental things that again, shame tie in. Mm-hmm. I can't do my job, or I am leaking urine. Like these are big things, and they're the most common reason that I see women come in and have this openness to want help. So in postpartum especially, I see women that have had sutures or they've had episiotomies or vacuum extractions of their babies' heads or forceps. I mean, so much potential for trauma. Mm-hmm. And they come in and they're like, I'm not the same. Mm-hmm. I am not the same as the woman who went into this birth. Like, I am fundamentally changed. Heart, mind, body, soul. But hello, my pelvic floor is different.
And they are fundamentally changed.
They
have just become a mother.
Literally.
First, second, third, whatever time.
Yes,
so they
every time.
And how they're with family is constrained if there's scar tissue and if there's that sense of brokenness. So when when we are in service to that,
Yes.
the child is more connected to the mother.
Absolutely.
So is the other child. So is the partner. So is the auntie and the uncle and the grandmother, grandfather.
Everyone.
So it's like we're bringing people back into the rightful flow.
Absolutely.
But not to stand in righteousness. It's just
No.
like the deserving.
But
of
in
connectedness.
alignment, yeah. And just to hold presence
Yeah.
and hold space for these women to be like, you are absolutely changed. Look at you.
Uh-huh.
But look at you.
And here now you won't lose urine all day. Try
Yeah.
now. Yeah.
But
Yeah.
you're still you. You didn't lose you because you had a baby. You're still you.
It's a big part of what you do, huh?
It's huge. And to just to bring them back and validate to them, hey, pelvic floors can look a lot of different ways. Vulvas, all of it, it's all different. Everyone is so different. I mean, I see women exclusively because they want me to look at them and validate that they look normal. Because they don't have another space for that. They have no idea what they're walking into.
Yeah.
Because they're getting a whole lot more than that. But also, yeah, I'll look at you and yeah, your vulva looks great. But also, why are you having that consideration for that and the shame, the potential, the worry, that doubt? Because it's doubt. I see women for doubt a lot. Doubt of self. Doubt of connection, doubt of tissues, doubt of ability to receive or give pleasure, and shame, and there's doubt.
Yeah.
And they go together a lot of times. So, and especially, I mean, having a baby is a big heckin' deal. You've brought forth life. And by whatever means, even a surgical birth, a C-section birth, can do remarkable things to a pelvic floor and still need reconnection or an opportunity to birth that out or realign. So
I see, as you're speaking, I'm seeing the sphenoid ethmoid junction and the something in the sacrum. They just want an opportunity to find each other again.
Yes.
And then the doubt can
go
change into creativity and hope and opportunity and options.
Joy.
Yeah. But those two hinges especially.
Yeah.
So talk more about that.
The sphenoethmoid junction.
I love that conversation.
Yeah, you do.
Yeah.
I just feel like it gets on the physical.
Yeah.
Those bones get a little compressed often after birth. I don't know how. I've seen it a bit with all the pushing and so sometimes I'll do physical work in the pelvic floor, but then at the end of the session, I'm like, yes, right there. I can't leave without working here.
The tie-in.
Yeah, and it doesn't take a lot of work. It's the acknowledgement, the knowing that we bring to those bones could float together better, and float with each other better.
Yeah. One of the things we see with birthing is that, from a body worker standpoint, is that when a birth happens in its most complete form, which is still incomplete in many ways, there still requires a community of people to help complete, because nobody completes the day of the birth. So I'd like to address that first of all, that it takes time to complete a birth. It's like an open wound that should be left open until it's healed from the inside out. And so when the birth happens at its greatest, meaning mom was most prepared and things just went really well, the pelvis opens, and along with that, ethmoid and sphenoid open. And I don't know which one's opening first. I just can't tell. I don't know that it matters. I think at one moment, one is holding the other back, and the other minute, the other one's holding the other one back as it begins to negotiate in some sort of structural agreement to expand, that then allows for the birth. And those births, the top of the head seems like it's almost just going to explode open. It's so fucking open. It's just wide open. Totally. And they don't all get that. And during birth can be really hard. And so we try to replicate that here. And that's what's cool about touch, is that you have those kind of opportunities. And then once that's replicated here, and that person goes on to reference where the birth they came from and the children that were birthed that day, everything changes. They're referencing something more whole.
You're saying they're referencing their own birth, right?
And if you clear those things, they're no longer referencing the original birth.
Yeah.
when they go back to get the birth that made them, they get the one that they got. They got the most recent one.
Yeah.
And that's where the paradigm shift is, and that's where you get into South American medicines and anything that's a purgative or anything like that. That's very much what's happening. That's where the paradigm shift is, when someone has trauma that they've come across in the event and in that ceremony, and they go about purging that. When they go back to get the trauma, they can't get it. It's not there. So, anyways. It's really interesting opportunities, and Bodywork's a good vehicle for that.
Thank you, Bones.
Thank you, Bones. Yeah.
Thank you, Bones.
Difficult Bones. Thank you.
Shame, thank you.
We're back again, and I'll tell you, man, we have a really good time on breaks around here. It's hard to keep a company. It's hard to keep a company open that has so much fun on breaks, though. So I feel like we skipped something, and there's something we talked about earlier that had come up about why in the world would you leave a profession that was probably doing really well? Yeah. Like, what caused the split for you? And just so I don't forget, then the question is going to be, what about the boys? What do we need to know?
Great.
So I don't know if you somehow package those together, but if you can.
Somehow they might, yeah.
So let's start with what happened here.
Yeah, what happened here?
How did you leave that's a pretty open career already.
Wonderful career.
Yeah.
I loved the practice that I had created within a few years of graduating and then starting to work, so about 2003, 2005. But then I had a pretty big realization that in doing this care where I was doing like some proctology and some gynecology, I can just feel this in my body, the kind of violation. It felt like it was too fast for people. And maybe I just always had really sensitive people coming in for work with
Probably
me.
Not.
Probably not.
Yeah.
Probably this is quite violent,
It is.
like using a speculum.
Oh, it's exceptionally violent.
I was also surprised that I was trained to like make this contact while kind of looking away to suggest that don't worry about me, this isn't sexual.
Yeah.
But also like the expectation in gynecology was to be out. Nobody wanted to give actual touch because you didn't want to convey the wrong message and then have someone, it was just so fear-based. It was so weird to me because I thought, I know me. Yeah. I know what I'm doing here. I'm trying to provide a service so that this person can move forward in their health and check if they have cervical cancer or whatever the thing is.
Right.
And it didn't click for me to do it quickly quick. It didn't click for me to do it quickly and just stay on schedule.
Right.
I wanted longer sessions. I wanted to touch people. So that was sitting around, so then I shifted my practice to be a slower practice, but I was still doing all these things. And then I started to realize that people would ask me for this advice, even about like diet or whatever, things people see naturopathic doctors for. And I would sort of give them these answers as if I were an authority. Like they would one, expect me to be an authority. And then I would sort of like step into it in this weird way that also wasn't right for me. Like, I don't know. What do you think you should eat? I was a big subject in Portland.
Yeah.
A lot of cities were like, we really want to be healthy. But none of that fit with what I'm here for, which in order to really tune into what I wanted to do, I really had to say no to any kind of fixing.
Yeah.
And still it'll walk through my door a little bit. And I try to just, decompress that pretty quickly and come into like sacred space. But the whole paradigm of doctoring and healing is like just like slightly infected here and there. And we have to be, I think, very careful and really give people all of their power back if they're giving it to us.
Right.
And I especially find it interesting to do that in the pelvis. I think I'm fascinated by this power stuff with pelvises.
Yeah.
And I love helping people have their own power. And that's for the masculine too.
Yeah.
And that's what I wish for the masculine is that you're not walking around like afraid to really be in your pelvis, because your pelvis is a gift. Mm-hmm. It's a gift for the feminine, and she is a gift for the masculine if that's the way you're lining life up. There's lots of ways to do it. But that's what I would really say for men is really be in your body and then wait. Just wait a long time. Just wait a long time. And when you know you have permission, then enjoy.
Yeah.
but it takes longer than you think. And it's worth the wait. That's
Yeah.
just like why I went away from that quick doctoring into the slow, because I knew that once I waited for people and they had all of themselves with themselves again, anything could happen, meaning blood flow can go to a liver or a kidney.
Yeah.
And now I'm not giving liver herbs or kidney herbs, right? Isn't it about that, like,
Yeah.
nourishment of blood and chi?
Sure.
So if we all hold it spaciously and wait for the nourishment of blood and chi, that'd be a pretty different world. There'd be a lot of harmony in that world. A lot of good dancing. That's what I have to say. Thank you.
Thank you. Megan, you got anything?
No, you did so good. I have so much appreciation for how your path turned, because mine did the same thing. So yeah, I was in Western medicine, so I wasn't even a naturopath. So no, and then once you start to see it, and once your eyes kind of start to open to, like, wait a minute, wait, because I do pap smears without speculums now, exclusively.
great.
I still offer them,
Great.
but I haven't used a speculum in years, and still I get really solid screens with everything they need. Or if you need a speculum, allow the woman to put it in herself. Like, hello.
Also warm it up first, please.
Yes, warm it up and talk to them, show them, let them hold the tools.
Yeah.
These are really simple things that are being missed in Western medicine. So no, I've been on the holistic health side of things for, a while, more than a decade at this point. And there's just so much more potential for opening in it. But, I love that you've moved completely away from it. You're like, other people can do that. I'm still doing those things. I'm still drawing blood. I'm still doing pap smears, but it's because to me, they're needed, but I can still offer it in a different way.
Yeah.
So
I think I would still do it if I didn't contract so much.
I think that's fair.
So because I go like this when I draw blood, I'm like, how about we don't
really?
do that all day?
Oh, that's so interesting. Yeah. No.
So why put myself through that?
I get that. Yeah. My body doesn't react to it.
Great.
Yeah. So
She loves to jab people with sharp things.
it's perfect. It's really fun. Hand it out all the time here. But no, what you do, it's beautiful and it's a gift. So just the reconnection. So do you work on men, or is it just, yeah?
I do.
And what does that look like for you? You work on the intra-pelvic?
Yeah.
Okay.
Yeah, it's tough. There's a lot of
Yeah.
guarding in there.
bet.
A lot of fear to be free,
Yeah.
fear to really do it, fear to really have sex,
Yeah.
fear to really, the F word.
Mm-hmm.
And seems like in our society, there's also this everyone has to be the top dog. How can everybody be the top dog? Y'all dogs. There's not one top dog. We're good. But that seems like it gets
There's a lot of talk about stress on women regarding looks and things like that.
Yeah.
But I find it to be really heavy for men, especially around money and success and
resources.
So yeah, it's a lot.
Yeah, I feel like that's in the piriformis in the back.
Yeah.
Is that resource question?
But if I go against that and I develop a life that's free from that, I'm still in the same paradigm. There's got to be something that's not in the dichotomy.
Yeah.
Because if I go, no, man, I'm going to break free from this, and I do all the things of, let's say, hours of meditation a day, and I just work to get the money I need, but it's in response to that, I'm still in it.
Yeah.
I'm still in it.
Yeah.
And so it's like there's got to be something that operates. Well, it's probably something that's above that, transcends that.
Yeah. I also feel like it's also below that.
Yeah,
It's
okay.
like both or something.
Yeah.
Yeah. Or it's front and back or something. It's round.
Okay.
I don't know. Now I'm thinking about prostate and piriformis.
Well, no, I am too. That's what's cool about being with people like you guys is that we start thinking about, well, how is this also the body? How is it the body? Not theoretically, but exactly.
Yeah.
And just it doesn't take, you don't have to look very long to go, there it is.
It's like prostate's free to flow. It's free to flow. It's free to feel. And piriformis and coccygeal muscles in the back are free to stand tall, free to move, free to dance, free to receive too. There's receptivity there.
Yeah.
You're so generous, and can you receive? Yeah. Oh, that cycle. Yeah. Yes, it's not easy.
Good subjects.
Good ones.
All right.
Let's keep it going.
Anything else? Any other body parts we need to talk about?
Breasts.
What do you think about, breasts? Let's say that we have the Don't Skip the Breast program here at Kino.
Oh, cool.
So I just made that up.
Oh, you did? Okay.
Yeah,
But,
just not a. We're gonna get stickers next, though.
But that's how real that
Yeah.
program is. Like
Yeah.
we are, we don't.
Good.
We don't. We work on breast a lot, because I recently had a patient referred here that was referred by, it had been a lot of, I won't say any names, been some really amazing therapists, and they skipped her breast. So we worked on her breast and took all the credit. We were like, yeah. She was like, oh my God, you guys are great. All we did different was work on her breast.
Yeah.
The fact is, nobody was touching her breast.
Yeah.
And talking about shame.
Yeah. And we just impart that when
And
we
of
avoid.
course, we worked on her as ethically as you can imagine. And we gave her, I mean, just all of the respect you could possibly get. Like, and I don't know, she's transformed. It's a very different person. I think I think that's how cancer starts.
I do too. That's why I think
it starts like a
needs to be in the
seed.
conversation.
It's like, man, you got to be careful.
Yeah.
Or maybe the lack of ease starts that way. And then it fundamentally becomes dis-ease. And then the next thing you know, you got a problem that's hard to turn around.
Exactly.
You know, because it started years ago.
Yeah.
Something you were mentioning earlier about is that you were mentioning something about diagnosis. About you didn't want to, you didn't call it diagnosis. Maybe you didn't want it. People are always seeking the answer.
Yeah.
Like, what do I have, doc? You know?
And the authority, like putting me in a position of authority.
And so one of the things we did years ago here is that we agree to work on the things we can correct. And that leaves us out of just that alone. Well, functional medicine's that way. It's really looking at correctability, right? So you could say, if we were to make up a name, call it functional touch. It's just the recognition, it's asking of the question, what can I correct here? And not necessarily logically connected to the complaint. It's just the question of what's correctable. And going about correcting until there's nothing else that I can find to correct. And 100% of the time, the list of complaints is completely different. And they're a lot more actionable too. You'll find that as those things get corrected, the body starts communicating really nicely. Starting going, hey, I don't like this situation, opposed to something disease oriented. You know,
you can always let the name of the condition just stay in the backstory. Like, you know what it is, whatever. Like I do. I'm just like, oh, I know that's such and such, and it's there. It's maybe in their chart. Or if I bill insurance, it's there.
Yeah.
But then using that other paradigm, working with the other paradigm, that's like the opposite of cancer. It's opposite of that seed that starts that illness, like in the breast. Like we're just working with expansivity. And yes, there's so much medicine there. Yeah, there's so much medicine there.
And the reason it's going to stick and the reason it has stuck is because it works. And the medical profession is doing a nice job of following us really slowly.
Agreed. Yeah.
But they're following.
Yay.
They are. They are. And part of it is that there's money here. I mean, let's face it. I mean, all of us need to make enough money to live. And so there's got to be enough money doing what we would do. And so either we've got to be in a fad or we got to be doing something that really works. And we're in one of those two right now. We're either in a fad or we're doing something that really works. But because things like meridians and, you know, acupuncture, that's been, how old's acupuncture? I mean, thousands of years old. So no research needed there, right?
No, zero needed.
Yeah.
Keep going.
But there's people, there's colleges paying for research so that we can prove that, which is a waste of money, you know, because it wouldn't have stood the test of time if it hadn't have been for.
That's right. It's so simple.
It's still here.
Yeah.
You know, what are the other things that are just not? They're not here anymore, right?
So it was coming back to your touch,
Yeah.
the simplicity of touch.
Yeah.
There's such a paradigm shift going on right now, and touch is right at the front of it, I think.
It is.
It's right
Well,
there.
it's at the front of the movement. It's also in the front of the reality of what's needed.
Yeah.
And so it's important that we get that, and that I don't mind being in the front of the movement, and I accept that, and even accept that I may have been involved. Like I accept that. I like that because I want to do something meaningful, but I also want to do something that's real. And I think the movement is based upon something that's very real. The movement, and the movement I mean is the return to touch, touch revolution. Like these things are real. Why are we returning to these? Because these fundamental needs were broken and missing. They'd been pulled from us like they didn't actually belong there.
Oh.
We'd been convinced. I mean, think of how we've treated our children over the years, and that we've either not touched them or we've touched them in ways, going back to the way I was raised. Even like I was raised deathly afraid of my father, and that's also a form of touch,
Totally.
And if you don't get the power of touch, then watch it misused.
Exactly.
Watch it misused, and then you can go, holy shit, that is really powerful. That is really powerful. And we can turn that around. If it works that way, it has to work the opposite way.
Yeah.
And so for us here, we are absolutely involved in the touch revolution. And we are involved in the return to touch. That's the reason you're here, by the way. That's the reason you're here.
Honored.
And we're honored to have you here. I think it's going to take a lot of us diving into this to make sure it happens and that it doesn't get derailed by forces that want to control it. For example, colleges beginning to train massage therapists and through protocols, and you can even look at institutes where the original practitioners passed away and they've become protocol machines, and we got to be careful there.
Yep, we do.
Yeah, and so Kino is going to live and die on this. That a therapist, to be a good therapist, got to do their own work, no matter how messy it is, or how many weekends they got to spend away to do that work. They got to do the work, or they won't be very good. And so, anyways, it's been an honor to have you here.
Thank you. Thank you again. Thanks for coming back to the good questions.
It was great.
Yeah.
Absolutely.
Perfect.
Megan, thank you.
Yeah,
Thank you so much. And I think we're going to wrap up.
Let's do it.
I
For
think
real this time.
about 3 hours is probably enough. So you've been listening to Touch Revolution. Thank you so much for being here. Keep an eye out for our next podcast.